Good morning, good morning, good morning, good morning, everybody. Happy Thursday. It is Table Talk Thursday today, and we're very excited to bring today's session to you. It is the International Women of Blockchain event. My name is Olienka Odenerin, and I am the founder of Black Women Blockchain Council, as well as the creator of the International Women of Blockchain event. But I could not have done this without my wonderful committee members, as well as the individuals behind the scene who have signed on to be part of this craziness that I'm bringing to you for the entire month of March. And all of our speakers across the globe have graced our stages and will grace our stages. They have to be commended as well for the knowledge and information that they're bringing to this live stream. Thank you all for joining. We have been running this event since March 1st. I'm really excited to be running it since March 1st, actually. And we are going strong. It is day 24, and we still have a lot of women that will continuously grace our stages so long as this event is going on for the entire month of March. We're kind of sad that it's about to end, but we're very excited that we were able to showcase various women in this space who are building, creating, as well as educating the community about blockchain. And when we say we are international, we are international. We have women from all over the place. And today you will have a speaker from Paris who will come on and speak to us. We also have individuals who came on from Australia, who came on from India, and all over the place. So we're very excited to really represent women in this space and let you guys know that it's not just a male-dominated space. There are females in this space as well, and they're doing a lot of things. They're involved in a lot of the use cases, and I'm really excited. So with that said, I'm going to go ahead and bring up our moderator for today. Corey, come and join us.
Hi there, Yinka. How are you this morning?
I am good. Good morning. Good morning. So, Corey, I know you have a great lineup for us today, and I'm really excited. So I'm going to let you take it away. Have a good one.
Thanks, Yinka. You guys get ready to take notes. I hope you have your pens and pencils ready and your notepads out because we have a wonderful lineup, as Yinka said, for you today. And first up, we have a guest that I am very, very proud to introduce, Dr. Mariel S. Gross. She is a bioethicist and an OBGYN at the University of Pittsburgh, UPMC, and Johns Hopkins Berman Institute of Bioethics. Her work addresses ethics of evidence and structural justice in learning health systems. So we're going to let her tell us that how she's working with NFTs and blockchains to explore the healthcare system. So without further ado, here she is, Dr. Mariel Gross.
Hi there. I should say I have a friend with me here that's joined the dog. This is the dog Gertrude Stein. So in case she makes an appearance mid talk, you'll know what the name sake was about. Well, first of all, I just want to say good morning and thank you so much for the lovely intro, and to Yinka, thank you times a million again for inviting me to speak to your audience. And I think that I'm going to try to go through my slides as quickly as I can so we can give time for the audience to have this be a discourse, because it's the feedback of this audience that I'm so honored to have the privilege to engage with as it continues to inform the work that I'm doing. So let's see, how do I share some slides? All right, perfect. So I'll try to, this is an academic presentation, and I'll try to veer from the super academic aspect of it, but the title of my project for the academic audience is about NFTs for ethical and efficient use of biospecimens, or you might think of them as biosamples, which are the tissue samples and blood samples and all sorts of other biodata that we produce in the setting of clinical care and research. And just at a super high level, as a audience, very invested in the NFT space and really understanding, and I think, appreciating more than most audiences about the importance of NFTs for art and really ultimately for social justice, I think at a broader scale. I really, my focus on the ethics of evidence in learning health systems has really led me to criticize the way in which medicine has overemphasized itself as a science for a variety of cultural and sociological reasons, as well as medical and scientific reasons, really at the expense to which medicine is an art. And I think, at a high level, I want the audience to think about the ways in which NFTs can help us reintegrate the art of medicine with the science of medicine and really bring a way to rehumanize biomedical science and the implementation of it, which is really precision medicine. I will just throw my disclosure up here because I am developing a technology which I'm working on commercialization of, although I'm giving a academic presentation today. So to start off the discussion, I use a term from the ethics space called the learning health system. And at a really basic sense is that, historically we've looked at medical care and research, and we meaning bioethics and therefore all of the associated medical and research communities, separated care and research into two separate enterprises that are in parallel, but really interconnected through what I consider a series of chutes and ladders. Now, those care and research were separated on purpose for the sake of protecting people. Anybody who's spent some time learning about the history of medicine and history of medical research understands that there's a pretty grim past, and that doing this was viewed as necessary for protecting people, particularly when participating in research as a patient meant that you were part of an experiment, and that was risky and dangerous and quite different from the protected space of clinical care and medical care, where you're really first and foremost protected by the fiduciary relationship with your doctor. The idea of a learning health system is really where we think we should be going with healthcare as a system. And the idea is that care and research, while separated conceptually and as enterprises once upon a time, there's a deep sense in which really delivering precision medicine means being able to have each and every person as a subject in ongoing continuous research that's iterated and directly implemented into their own care. Precision medicine is N of one in the best way possible. And in order to do precision medicine, those samples from our blood, our tissue, our all the other biodata created about us, whether it's wet data, like things that are in a laboratory, or in silica data, all of that data is necessary as platforms for learning in order to drive precision insights, both precision insights on a population level, like people like you are treated more precisely, but also precision insights in the way that N of one is you, and that medical treatment is tailored directly to the person who we're treating, and not just a more vague population of people that are approximately like them. Yet the real challenge for our system, in which we're constantly taking from care and learning for research, and this little symbol is a biobank here at the bottom of the cornerstone of the research enterprise, you could see that there's a lot of loss, and there's a lot of, therefore, missed opportunities. And really, one of the biggest missed opportunities in the current system of care and research is that patients do not benefit from research on their own tissue today. And in fact, most tissue that we create as a byproduct, as it were, of providing clinical care is discarded. For example, my focused use case is in breast cancer, and at my hospital, which treats over 2,000 patients a year with breast cancer and breast surgery, over 90% of that tissue is discarded. And so trying to break down, what are those dots, and what are the mechanisms by which our integration of care and research today is allowing for a system in which a patient can contribute to learning and yet not be directly benefited by the learning that comes out of their own tissue and data. Now, mind you, this problem continues to accelerate in light of the biomedical research that's occurring today, and we'll get into that, the nature of that. But the idea of science accelerating and learning happening faster really has challenged this concept that you could ever possibly separate the care of an individual from research, because when we originally did that, we didn't really have in mind the potential for that patient to benefit. We were only thinking about the potential for that patient to be harmed. But once you think about research as something that could benefit a person, some of the mechanisms by which we enable patients to participate in research is kind of an exaggeration. They're not really participating as active stakeholders, they're more passive. And so de-identification has really been one of the focuses of my research, and the topic of study for several years now has been on the ethics of using de-identification as a mechanism to empower learning from patient care at scale. And in our system of the two adjacent circles, de-identification can really be represented by the blank spaces here between that arrow, because a person can be included in research, and in order to ostensibly protect their privacy, their name is removed from their data and their tissue. And my theory is that doing this on a systemic level, because it's used to ease research and diminishes the burdens of compliance for research projects. For example, if you do research on de-identified samples, it's not considered human subjects research. And therefore, for those of you who've heard that term before, that therefore you're not subject to IRB or Institutional Review Board regulations, the same as you would be if you were doing research on a human subject. It shows how you could end up learning from a patient and then not having a way, or not intending to translate that learning directly to that individual. And the thought is that that really represents a major barrier to the system as one being able to deliver precision medicine as a standard of care, if all the learning we do from patients is disconnected from them and then left to filter through the system rather than being directly implemented back. And so to kind of focus the discussion in on this somewhat expansive problem space, we're going to talk a little bit about breast cancer organoids, which it's another complicated topic. It's great to speak to an audience that I don't have to also explain what NFTs are, because usually I'm explaining some degree of what both of them are. But a breast cancer organoid is simply an example of the future of biological platforms for learning. And so historically, the ability to study and do research on patient cells, human cells, outside of the human body was what we call those cell lines. It's one type of cell, and they live in a petri dish in a flat sheet. And that's in 2 dimensions. And an organoid is simply the cell line 2.0, in which we now go into 3 dimensions. And instead of one cell type, it's a group of cell types, and they're derived from individual patients' tumors. They call them actually patient-derived organoids. And they recapitulate the 3-dimensional, they're self-organizing, they recapitulate the 3-dimensional structure of a tumor or other, organized. The organoid comes from organ, which is an organized group of cells, and behaving together in a specific way. And they enable us to do research on that tumor that really has been unprecedented, in that there's these 3 major categories of research that are really unlocked by organoid technology, because it's because we're 3-dimensional. The 3D model, although not perfect, is such a better model than a 2-dimensional model, that we really view this as this next inflection point in biomedical science. And that inflection point comes around 3 major things. The first and foremost thing is precision cancer treatment, or precision medicine in general, where that individual's tumor, instead of taking that person and giving them a standard of care that was devised over that group of non-specific people that are somewhat like you, they could test cancer drugs on your own tumor and enable that treatment to guide the specific, testing 400 plus drugs on a single tumor, and decide, okay, which actual drugs are responding, and then which combinations are the best, and which of those represent the best balance between beneficial effects and limitation of the toxicity. And so organoids being able to be developed from an individual's tumor are seen as this potential to really become precise in how we leverage the medicines we have for treatment of cancer. The other 2 major categories are drug and therapeutic and diagnostic development, so research and development of new technologies. And then ultimately, there's a thought that organoids are going to play a big role in regenerative medicine. Just to put a fine point on it, the Hub, which is the organoid commercialization program from the grandfather of organoids, the person who first developed the technology, they call the organoids a patient in the lab. So this is a living 3-dimensional model of a patient, from a patient, and it's in the laboratory. And so where we're at today in the system that I was describing is that this article was in Wired a couple weeks ago. They call the organoids avatars of tumors. And during that research, you could draw your attention to the text over here. These researchers were able to find unexpectedly that for a very aggressive cancer, a specific drug was useful for treating it. And yet, because that patient had been de-identified for the purposes of allowing their tumor to be used for research, that researcher was disempowered to return a result that they thought could be life-saving. And in fact, by the time, even though the drug itself had already been FDA approved and the patient was more mortally ill, by the time they were able to connect the dots back through the back-end infrastructure of our learning health system as it is today, the patient had passed away. And so it's a pretty poignant, I think, illustration of both the connection between, bench science and that what's called preclinical research on the one end, and clinical care, and both the opportunity to integrate them better, and yet the gap that exists in the system as it is today. And so, organoid technology, the status of it is really that we're developing these 3-dimensional living models of patient tumors that are thought to have a tremendous amount of potential for changing the future of, in this case, breast cancer treatment. And yet the patients who we make organoids from don't know about them, because they sign a broad permission slip saying, yes, take my tumor for research, which most people do. About 90% of patients at our center do, and that's common. And yet those patients not only don't know about them because they have no expectation of receiving any information about the follow-up on what happens with their tissues, but they don't share in the benefits, even if they could be clinically relevant. And of course, to make, I think matters more complicated, in order for organoid technology to scale for delivering precision medicine as a platform that we can provide to people and not just have a one-off in the laboratory, commercialization is necessary. And I think that adds more ethical complexity to the nature of the problem. And so the way that I've really been thinking about it has been really expanded through my collaboration and a relationship that I've developed with the photographer, David J., who, and his, indirectly, but through engagement with the subjects of his photos, who I think by simply covering their eyes, this is from the SCAR project, which is, as you can see, photographs of portraits of young breast cancer patients. You could see that by taking the standard medical textbook approach to protecting the privacy and de-identifying the patient for the purposes of learning, I call them subjects on the top line there, because by removing by simply covering their eyes, your eye is drawn to the scar and drawn to the person as an object for your benefit and for learning. None of the things that are readily apparent on the bottom level of the patients that are identified, which is their, willful participation, their knowledge that they're being photographed, their vulnerability and their willingness to share their experience for the benefit of themselves, but also for the benefit of others, is actually a really powerful, I think, metaphor for the way that we think about our participation in research when we're doing so as patients. And the reason why do most patients share their tissue for research is very similar to the reason why these people had their photos taken. And I think that the potential benefits are comparable, and I think they're comparably diminished when we de-identify patients in this way. The people on the bottom are individuals to whom we owe something. And I don't think you could say that of the row on top, even though it's ostensibly the same exact image. And, for those who've been thinking about this in the biomedical science space, may recognize a familiar, I think the most familiar example of de-identification as a mechanism of learning from care is the HeLa cell, which is simply the first human cells. Those cell lines, the original cell line 1.0 came from a woman named Henrietta Lacks, and it was from a tumor that was removed during a sample that was taken during the provision of her clinical care, very much like we do today. Now, people end up focusing on, the differences between the legacy system and the setting in which her tissue was incorporated into biomedical research. But I've really focused on the way in which it's very similar. So we have informed consent, a paper, but we don't really have informed consent, a process that's capable of delivering the transparency and engagement and ultimately the accountability that we really need for biomedical research today. And at the same time, HeLa cells were the first example of that human tissue grown outside the laboratory, and that first major inflection point in 20th century and now to 21st century biomedicine. As the story goes, billions have been made, and yet it was only really by accident that her family ever became aware of their own legacy and their own role. And, the extent to which they've benefited from it has been marginal, to say the least. And so coming back to our, hypothetical model here of care and research, the future in which precision medicine is the standard of care is one in which research really deepens what it means to provide care. And yet, how do we get there? How do we overcome the non-trivial ethical, legal, socioeconomic, and technological barriers that have been intentionally erected for the purposes of essentially preventing this from happening in certain levels? how do we overcome them? And, how do we deliver that engagement, transparency, and accountability that we believe that this system demands, and that the learning health system model really demands? And so my thinking about this has been really informed by, studying de-identification, as well as the potential for blockchain technologies and specifically non-fungible tokens and other privacy-preserving innovations that can enable us to maintain provenance while protecting privacy of patients. There's a sort of fundamental aspect of transparency, engagement, and accountability that can be built into a health system with blockchain technology. But again, how the theory is there, and I've been studying this for a few years before really launching into the project I have today, the core concept of which is an NFT biosample ecosystem. And, this is my first time building, as it were. I've been a professor for my entire career, and I've been studying this problem of de-identification for well over a decade now. And I've been studying the potential value of blockchain, smart contracts, and NFTs as a solution since about 2017. And what I really am doing here today, and where I look for your guidance, is that I don't want to spend the next 10 years writing papers about how we could do this better. I want to go ahead and make it happen. And I do think that it's going to take, a moderate-sized army to overcome the obstacles, mainly of which are driven by the status quo and those who are benefited by the current ownership models surrounding patients' tissue and their data. The goal of my biosample ecosystem are kind of outlined here. I want to quickly go through a few more slides to kind of share some more thoughts about how this will work and the research we're doing to support it. But I really look forward to your feedback and questions. And so such a project that's been called quixotic by some and visionary by others, of really integrating, providing what I think of as the back end of the learning health system that's capable of delivering on its own mission, of sort of proving the false dichotomy between the need to de-identify in order to gain the utility of learning from patients, and perhaps the opportunity to do this a better way. And my team members range from blockchain scientists to heads of ethics departments, economists studying behavioral economics and market design for organs and tissue samples, labor theorists, organoid researchers, people that you may recognize as key advisors in oncology and tech development, art, and law. And really, this is truly a transdisciplinary problem space and requires a transdisciplinary solution. And I'm welcoming of more people to join that effort. Our current research, to take it back to a little bit of an academic level, has three main prongs. One is mapping our stakeholder incentives across the key stakeholder groups here, which is patients, physicians, researchers, and institutional and industry interests. We're doing direct patient engagement research in our intended breast cancer organoid population here in Pittsburgh. So we have about 150. To sort of take an infinitely large problem and zoom it way, way, way in, we have about 150 breast cancer organoids. And so my work with that patient population is both cross-sectional across all of the breast cancer patients in our system to learn the behavioral economics behind their participation in research and the values, motivations they have and what they want to know about the research samples that they have provided, as well as developing and iterating the personalized tokens of appreciation, as it were, from the individual use of those patients whose tissues were used to create organoids. And then we're developing a prototype. We'll have a white paper coming out soon to describe more about what we're doing, but I'll show you from our stakeholder interviews. Just in the past 3 months, we've done over 100 of them, really highlighting a variety of themes from patients. I think financial toxicity, the need for equitable representation have been constant themes. Physicians and the pressures, both of time and responsibility and accountability that they feel, have been huge themes from that population. The compromises that researchers are forced to make due to systemic inefficiency and the impoverishment of the learning that occurs as a result of our current system has been a really both an opportunity as well as a dark spot in terms of the extent to which data is siloed around institutions rather than around individuals where it needs to be. Industry, of course, is pressured to rush to market and is high risk. And they really importantly view tissues as super scarce and rare. So an appropriate fitting use case, I think, for the NFT as a mechanism. The reputational risks, if you think about the lawsuits and the values of nonprofit institutions, as well as some of these other cultural themes that we've highlighted. I won't go into these quotes now, but I'll come back to this slide to just post it up while we're talking, in case anybody wants to reflect on some of them, really highlighting the tensions and the incentives around this system. But our surveys, as I mentioned, we're surveying, and we will also be interviewing the patients about their values and preferences, especially and not to the exclusion of their views on profit sharing with regard to the not just the academic use, but the commercialization of their tissues and organoids thereby derived. We're testing also how to teach patients about what an organoid is and how to get them engaged, and really testing from the patient end the how to appropriately gamify and to engage people in something that they've been accustomed to allowing to be disconnected from their body in a permanent way, and how do we re-engage or re-identify them and get them invested really long before it ever is going to pay off in a either health or financial way. We're developing a patient-centered, our prototype is, I'm calling it a patient-centered biobank platform that includes a wallet of the samples. It includes something I'm calling the collaboratory, which is a Instagram-like gallery of different patient samples. By the way, the organoids are three-dimensional, as I mentioned, and they're imaged every week because their morphology is incredibly critical to their behavior and their structure and their identification. And so every patient who has organoids has images of them. And my first goal is to provide transparency and to return those images as tokens of appreciation to the patients for their research contributions. We're also developing what I'm calling study tokens, which you could think of as like a baseball card or a Pokemon card or magic card of a research study where you get a sentence or two about what it's about, but then you get a minute or two video of the researcher talking about why what they're doing is so important and why they really appreciate your contribution. And really critically, we give the patients the ability to control the consent for licensing their samples to users such as Dr. Adrienne Lee, who's the head of precision medicine and collaborator of mine in this project. For that specific, it becomes peer-to-peer between the patient and the researcher, which is currently a connection that exists as the dotted line. And so we're building our alpha prototype. This year, we're testing it with those two research protocols that I mentioned. My goal is for next year to be doing that as an MVP with our first customer and to go from there. All of this is really based on the fundamental assumption or understanding that I think I may not be the only one who agrees with here, that people are fundamentally unique and non-fungible, that our duties to them as physicians and as researchers cannot be exchanged, even if the tissues or data are, and that an NFT system is really fit for purpose for maintaining the continuity of care for those patients in research, and then ultimately for empowering precision medicine as a standard of care that we can deliver at scale. That's really all I have for you. My strategy at a high level is first transparency, then engagement, and then accountability. And I'll land us back on our quotes so people can read over them as we're chatting. Thank you for your time and attention.
Had to unmute myself. First of all, Dr. Gross, thank you so much. That was a completely fascinating presentation. I learned a lot from it. And I have to say, the subject, and particularly of breast cancer, is very near and dear to my heart and hits home. I had an aunt who was an anchor to my brother and sister and myself, and more like a mom during our really crazy childhood that we ended up losing very early to breast cancer. And I remember, being with her as she was going through her process, her chemotherapy, and all of her medical care during that time. And I remembered, I was a teenager at the time, how dehumanizing some of it seemed to be. And so I'm very moved by your research and what your team is doing um, in this area of medicine. You mentioned a very high profile case that some of us know about and some of us have heard of, Henrietta Lacks. So for those of us who may not know that name or may not be familiar with it, can you give us just a little breakdown of what her story was and how it is relevant to what your research is right now?
Yeah, absolutely. Thanks for that question. And thank you for sharing your personal um, story, because I think it's the personal stories with cancer as a family member, that was certainly my first experience in that space too. And it frames this, right?
Yes.
Um, Henrietta Lacks it's very interesting. She was a Black woman, mother of five, who in Baltimore City, which is where I trained, received care, and Johns Hopkins University, which is where I trained, in 1951 for cervical cancer. And she was in her early 30s at the time and had an extremely aggressive form of cervical cancer. At the time, they had not yet grown human tissue outside of the human body. So the potential to separate. So it's very interesting. Henrietta Lacks, her cells were the first ones to grow outside of a human body in the laboratory, and therefore enabled all of the research that made medicine what it is today,
Wow.
simply by that process. Because what it did was it enabled actually the separation between the patient and the subject. Because you could test things, you could do an experiment on cells in a petri dish that you could never do on a person. And that was at a time when research was experiments and it was dangerous. Now today, the National Cancer NCCN, which is the National Cancer Guidelines organization, says that the best care of every patient with cancer is in a clinical trial. That's our gold standard. So talk about flipping that on its head. We came from a place where she empowered the separation of patient from subject. That's how we got to biomedical science and medicine as it is today. And now we have to, her next leg of her journey is to reintegrate that care, the patient and subject, because now it's about giving people access to the research, right? Not because if you or your loved one have cancer today, you want to be in a clinical trial because you want the smartest and brightest people treating cancer, studying cancer, not to give them what they've already proven, but to give them what they think would be even better.
Absolutely.
So we need to
Yeah.
reconnect that patient and subject. And I think that her story is told often, but the fact of the role of de-identification in it is not featured enough. And I think it's about, simply it's about saying her name, but really understanding what that means as a process on a system level that becomes so
Yes.
important.
Absolutely. And you're, everything that you're saying, and again about putting the human first here, is so key to in majorly what's lacking in Western medicine. And for people who don't know, they have since made $35 billion from the research of Henrietta Lacks cells. And you saw the slide that Dr. Gross shared, where the family, and maybe you've seen it in the headlines, is suing the biotech company, and rightfully so. As people of color in particular, and women, marginalized community, we definitely tend to get the back end, if you will, and not the most superior healthcare. Do you see your project helping that situation out?
Yeah, I was trained as a bioethicist, and with a background in philosophy from before I went to medical school. And at the last minute, I switched into women's health because I saw really the pervasiveness of the ethical dilemmas. And the specific one that I was driven to address was the disparity in inclusion in research, right? Pregnancy and with Black women, at least in the United States and honestly worldwide, I believe, for example, with HIV trials being another area of extensive research of mine, the disproportionate bearing of the burden of research, right? Whether it's worldwide through HIV trial research, where we're learning, our companies can learn from patients that then can then come here and sell their drugs to people that sort of that were built on the backs of people worldwide, or even in the United States, where our surgeries were developed on the backs or on the vaginas of some people for the benefit of others, right? That this has been at every level, every step of the way, women and Black women in particular have been disproportionately exploited by the biomedical research and medical establishment.
Absolutely.
And this is where, the Lax family, and we have one of my collaborators and co-investigators, the head of the Berman Institute of Bioethics at Hopkins, and has a personal relationship with the family because we're building a building for the Ethics Institute in her name. And they're, of course, deeply involved in that process. They're on I believe, the side of the moral correctness, but they're not on the side of the legal precedent. And that $35 billion is just that one company.
Yes.
So just to point, and they've put on notice, a list of hundreds of companies, right, of that have also profited, but they don't, in my opinion, yet have the mechanism by which the distribution of value can be crafted to reflect what we believe is morally correct, because they lack the legal precedent. Because today, I'll go super trying not to go off on a tangent. Today, the tissue that's removed from your body that you give to science is treated like the television that you left on the curb.
Wow.
Instead of the television that we know, those of us who are surgeons know, is a lot more like going into someone's house to take their television than it is simply picking it up on the curb. And so the idea that behind my research is about this idea that patient consented to that surgery because it was under the fiduciary context of the duty to benefit them, and to separate them from the secondary benefits that are thereby derived from that process is a violation. Now, I think it's great if it can benefit other people also.
Yes.
But if we neglect to benefit that individual from the products of their own body, then that's where it becomes exploitation.
I absolutely agree with you. The story that you told of the woman who died, even though her cells were used to benefit others, makes absolutely no sense. And it seems archaic in this day and age. And I'm sure that that's where blockchain can come in to hopefully, fill in some of those gaps and assist and support medicine and, for lack of a better term, doing right by the people that they that they serve, and keeping that Hippocratic oath that everybody who goes into medicine takes, but sometimes because of systemic failures find it very hard to keep.
Yeah. Well, this is.
Yeah.
Sorry, go ahead.
Go ahead. I want you to finish your thought, and then I have another question for you.
No, I was just going to say that I believe that the researchers who are doing organoid research, because of the obvious acceleration of clinical utility of the research that they're doing, are going to be motivated. It's all about finding that use case where we can align the incentives as best as possible in a system that's not set up for that, right? Because we're going to need people that in each separate aspect of this are going to go above and beyond what the system currently requires. And people who are developing research that could save someone's life, who's, sitting in that hospital across, like our hospital where we make organoids, sorry, our research lab where we make organoids is across the street from our hospital, where those patients are traipsing back and forth, as you know, from a family experience, for imaging, for labs, for
Yes.
treatments, day in, day out. I mean, we could probably see them from the window. But because their
Yeah.
name is not on that sample, we don't know the relevance of what we're doing to that person. And I think that by personalizing it, we're treating, just like we're treating the patients as dehumanized, we're also dehumanizing the researchers,
Yes.
right? Like they don't care, like they don't have that they don't share in the obligations of respect for people and beneficence and justice that underlie the Hippocratic Oath, also underlie the Belmont Report, which is the, sort of the code that we follow for biomedical research ethics. It's the same three principles: respect, beneficence, or do no harm, or try to benefit, but at least do no harm, and do so justly. It's the same principles. It's
Those
just different people.
pictures that you showed were so powerful, and I'm trying not to be emotional here, but just the difference between the top and the bottom, where you had the mask over the face versus putting a face to it, and that's simply what you're talking about here. Is putting a face back on those patients, and people react so differently when they objectify versus actually seeing another human being as a human being. And it was a major difference that was so moving for me to see that. And if we could do that just like everywhere in the world, not just in biomedicine, if people could just really get it. I think one of the other really major benefits here of the research and what it is that you guys are working to accomplish is that, especially with women, and you have only to look at current headlines and what's going on right now in politics to see that having control of our own bodies, how very, very important, and what a difference that makes towards being human, or being seen as a human who matters, who's valued. Having control of our data, which is what Web3 is giving us the opportunity to do. And then, taking that, steps further and having that control in every area, including our healthcare, it empowers people to a level and to a degree in which, if there was a face on folks that, like you said, they weren't a label on a tube in a lab, how much more brilliant and rewarding would the work be for researchers and medical personnel? How much more empathetic would people be?
Yeah. Um, you know, at its core, I completely agree. I think NFTs, for that reason that you stated, are really going to prove essential for human rights in a digital world. I don't see how they're not. And it's all about the unique individual and their interests, and self-ownership is, right? Ownership of one's own body is the most fundamental. It's autonomy and respect, right?
Yes, yes.
And we're rapidly accelerating towards the world in which all of our bodies, all of the data that they produce, and our genomes themselves are known, quantified, and don't belong to us. And the world in which everyone's genome's been sequenced and doesn't belong to them is one that I think we should be really motivated to guard against, because that's where we're going. And yet the focus on the digital data as opposed to the tangible physical assets is the biggest critique I have for the other projects in the Web3 health space, right? Because they're focused on the abundant, to the person whose digital data, health data, is abundant to them, and it's abundant in the environment. It's at this health center and at that health center, and Google has all this data. And the focus on the digital, I think, will not be able to rein it in a way that I think it's going to be critical because I don't view it as morally distinct. I think it's, biodata writ large, right? It's tissue, it's genetics, it's other omics, it's, your wearable data, it's your electronic medical records, it's the images you've had done. All of it is, there's a taxonomy, but it's all within you, and it's all a reflection of your body. That being said, focusing on the discrete tissues is going to, I think, be really key to getting a toehold here, because they're traceable and trackable and valuable in a way that the digital data just isn't. But that's greatly enhanced by its association with the digital data. And so that's how the rest of it will follow. I think if we get to that, really the materialism of it is, I think, really critical. And organoids are super interesting. Again, I'm a philosopher, so I wax philosophical, because they have principles. They're immortalized, and they have principles. They can be grown and shared and distributed, but it costs money. There's gas fees, simply, to doing so. And so it actually is a useful heuristic for figuring out a system that can work both for tangible physical assets as well as digital ones, because it has properties of both.
Yeah. And if you're listening to this audience and you think this is like way over your head, let me just break it down. Ownership is power. And we know that at the deepest levels of our being, that ownership is power. And there's a couple of questions that we have from the audience.
Yeah, cool.
Let me see. Is that a question that's there on the screen? This is fascinating, Dr. Gross. After proving this NFT system concept with usage of organoids, do you think this can translate to usage of tissues for work in other ways, e.g. 2D cell line maintenance in various institutions, proteomics work? Sorry about that. I'm not sure if I pronounced that correctly.
Yeah. No, thank you for the question. We have our silos today around the wrong things. Our silos need to be around people, individuals, not around institutions. And I very much believe that our system, after proving it in this use case, my goal is to provide this free of cost to everyone worldwide. This is a 7 billion NFT project where everyone has an NFT, and that it's their birthright, because it's the mechanism by which they're going to be able to integrate the care and research participation throughout the course of their life, right? The proteomics or genomics that's done today might not mean anything for 5 years, but when it does, boy, is it really going to matter. And if we allowed that to happen in a way where that person doesn't have access to or the rights to benefit from what's learned from their own, contribution, then the asymmetries continue to get exaggerated rather than addressed, because the system, right, like it leans towards longevity research rather than solving basic health problems that are treatable. And why is that, right? We know why. So it absolutely applies. Absolutely applies.
And thanks for that question from ResWorld44. Did we have one other question from the audience? And the next one is, do you foresee a monetization component for patients that might be interested, or is that too close to illegal organ selling?
Yeah. Well, I actually view the whole current status of what we're doing as micro organ trafficking.
Yeah, I hear
And
what you're saying.
commercialization is not evil. It's how you deliver from a research project to valuable human care of human beings. That's how we advance human care. What's immoral about the current system is that we do it without the most important stakeholder involved. We cut the person out, and all of the institutions, it's funny, all of the universities anyway, I'll say, are kind of in this conundrum of what do we do? And this person signed that permission slip, but not that one. And that was 4 consents ago. And can we use it? And so they're all sitting on these like proverbial gold mines. And because they view themselves as these nonprofits who don't want to, who are concerned about their reputations and don't, are wary of the extractiveness of the industry that as it's developing. This provides a solution for that, right? Like there are three kinds of benefit that patients can receive from being part in having their tissues used in research. The first and foremost, and this is because I'm a bioethicist, is personal knowledge and benefit, the self-knowledge of the nature of your own contribution and the impact on the future that you're having. And frankly, for people who are dying of cancer, that's the only thing they could take with them is the knowledge of their contribution. And that's important. And their families can keep that with them as well, of what their legacy is. But then we have on the other extreme, we have the health benefits, the precision medicine as sort of this holy grail of what it means to really be the beneficiary in kind to the research contribution that you do. And organoids are such a good use case for that. But between here and there, I think is building out the architecture that makes the holy grail possible. And ownership is important for that. Ownership and sharing in financial profits and commercial, really, we're on the side of the moral truth. We need the legal precedent in order to back that up. And we need the system architecture to enable it. And so the technology I'm building is an enabling technology, right? And the governance and the ethics of it have to be worked out. That's why we're doing all the research. That's why I kind of mentioned, we're doing research on these problems. And it, by the way, opens us up to, I'm sure, a whole host of other vulnerabilities, but there's no way it's in my mind that it's worse than what we do today, which is simply take the person out of the equation. And then you're either sitting there wondering, what can we do with this stuff? We don't have permission, I'm like, the people are right here. Where are, we just don't have a system that efficiently enables us to reconnect them with their own assets. And there's a true aspect of this system that is a perfecting of the collateral, right? The biobanks are, by the way, they're all losing money because the assets they manage are from donors rather than investors. The donors to whom they're not accountable.
Yes.
And that's why the first step in this process I view as very important is transparency, because everything has been sort of cloaked in the broad consent or the one time, you write about you just got diagnosed with cancer and you're about to go to surgery. And would you also sign this paper saying you agree to allow research on your tissue? And most people do.
Yeah.
Right? Because it's the right thing to do.
Mm-hmm.
But they have no mechanism for being assured that they will benefit appropriately to their contribution, and blockchain and smart contracts can empower that. Right? Like even my grandmother, she'll be like, I would assume that if they learned something that was relevant to my care, that my doctor would be informed. Well, that's just a logical assumption based on the fiduciary context in which the whole thing occurred. But the system can't deliver that. And my goal is to not correct the assumption. My goal is to correct the system so that the reasonable and appropriate assumptions that patients have about what we owe them can actually be delivered.
I love this conversation, and it's probably one that we need to continue to have in the research and biomedical community. And we were talking about, Henrietta Lacks and her particularly aggressive form of cervical cancer. I don't have the stats in front of me, but I'm pretty sure that Black women definitely have higher incidences, particularly of breast cancer. And so how this could impact the BIPOC community becomes a really big issue.
Yeah, it's interesting, actually. It's not so much that they have overall higher incidence of breast cancer, but they have higher incidences of breast cancers, such as triple negative breast cancers, which are not well served by the existing standard of care. So it's a little bit more, it's that, and part of this is my theory is that really if we look at all disease is rare because people are so unique, right? And so that, and the interesting thing about it is that because they've been less studied, because their disease is the triple negative breast cancer is the perfect example. Those are the most sought after tissues in the breast cancer space. They're sought after. They're
Wow.
literally, what was the term they used at the meeting I was in the other day? Vying for. People are vying. Like even at our institution, there's 4 people competing for every little sample of triple negative breast cancer tissue that comes across, untreated especially, because most people who have breast cancer surgery for triple negative breast cancer have chemotherapy first. This is like this is in the weeds, but because of that, at our center, we only have a handful of triple negative untreated breast tumors a year. They're the most valuable tissues. So it actually would be really empowering, I think, to, perfect the collateral and say, this is you're the owner. Which researcher do you want to invest in? Right?
Yes, yes, very empowering. Not to mention, like you said, what it would do financially for the patient, because this care isn't cheap, and the family.
The financial toxicity of breast cancer and other cancers is real. And I think that a system which exploits patients for the benefits of the many, without providing a baseline simple access to medical care is fundamentally structurally unjust.
Enough said. Let's go to our next question. What kind of pushback or questions have you encountered from other professionals in your industry?
The obvious one is that those who, the most common question you hear, if we were looking at the questions, the sort of comment slide, is the question of who owns the tissue. And to give you an example, somebody who's a prominent cancer researcher and head of a National Cancer Institute, Cancer Center, National Institute of NCI, National Cancer Institute Center, said, who owns the tissue? Is it the principal investigator from the study? Is it the hospital? Is it the university that they work for? Is it the funding organization? God forbid it's a private foundation and not the NIH, or is it is it this organization or that organization? I'm like, what about the patient? And so the biggest by far battle is that the extent to which we reassign or correct the assignment of ownership of human tissues, just like you can't own a person, right? You cannot own a living part of their body. And in my system, during a person's lifetime, you cannot sell your tissue. You can license it for research use under certain contractual terms where it's mandatory for that patient to be the recipient of the health benefits that come out of that research. And so when there are commercial benefits, they need to be able to be participating as well. But anyway, it's the pushback is all about ownership, is about the haves and the have-nots, and those who perceive themselves as benefiting from the current ownership model who are the people in control right now. It's going to take really enlightened ones to realize that whether or not they like this is what's happening. And that's where that's where transparency is kind of, I think, going to be really our key, is that simply by showing a patient what assets are in their wallet, we have this sample of yours, we have that organoid, there's these bloods, this is the date they were taken, this is the location, right? Very simple. The tech is the easy part, right? The tech part is the easy part. It's the ethical, economical, socio-political,
right?
Not, those are all the parts that it's going to take. But I think by just lifting the curtain, the ownership of those samples becomes very clear, because of the fact that, if you think through what are the good reasons why a person is not the owner of their own tissues and samples: lack of legal precedent, lack of empowering technology, right? Lack of foresight as to why that's essential for the person's benefit. No good reasons. No good reasons that remain. And once you show them what you have, it's clear that it belongs to them. And that's what's going to be, I think, the power that where our patient advocacy work is going to push this forward.
How can people follow you and find out, more about what you're doing?
Um, I'm not super active on Twitter, but you can find me on Twitter. I'm gynobioethicist, GYNOB ethicist. And you could, shoot me an email. It should be pretty easy to find my email online. And yeah, I mean, if you're if you have questions that we don't get to answer and you want to discuss further, I mean, there's so many cans of worms we've skipped across the top of here that each could be their own, as you suggested, their own conversation. And I would love to hear from you. So please do reach out, and whatever way you can find me, I'll do my best to respond in a timely fashion. But I'd love to have a separate event if people are interested, just to talk about this topic and hear your thoughts and concerns and
Yeah,
ideas.
it's a very powerful topic because all across all of our and that data is used and with often
Oh no.
standing up for and often to the kind of the folks who get to benefit, they're not us. And it's a very sad situation that Web3 definitely has the power to fix. Blockchain has the power to fix. NFTs being able to follow, if you just, imagine an NFT that could follow one of your patients from the outset all the way through their care, that, had the power to inform, educate, and then financially benefit that patient. What a major opportunity that would be. And thank you for doing this work. It's innovative, and you literally will turn medicine on its face and bio research on its face, or on its head, I should say, if you're successful in doing this. And I know that you will be, because it's the right thing. And this is exactly where Web3 is headed. At Web3 versus Web2, Web3 being about empowering people, empower to the people, versus the old, outdated, outmoded model that basically is obsolete, which is benefit just a few. And so I thank you so much, Dr. Muriel S. Gross, for being with us. I have thoroughly enjoyed this conversation on so
Thank
many
you.
levels. And you guys, you heard her. Go check her out on Twitter, follow her, and let's continue this conversation, and let's lend her support
Thank
um,
you.
as and where she needs it. And we're going to take a very short break, and we'll be back. Thanks again, Dr. Gross.
Thanks for having me.
Hey, and we are back from our intermission. I hope that everyone listening thoroughly enjoyed Dr. Mariel Gross and what she had to say. It was very powerful. And, if you were listening and thinking, I'm not a bioethicist, I don't understand those terms and the terminology, listen to the essence of what she was saying, what she had to offer us. And that was that we all understand that ownership is power, and we've got to take back our power. And we've definitely lost that in the digital age. Everyone else controls our data. Google, Facebook, aka Meta, and then it just goes from there. Not only our personal data, but also our data. And you never really think about those things when you're signing off on those forms, when you go for your doctor's visits, and if you're blessed with good health. But imagine if you're a person with a rare disease or cancer, and you're already going through trauma, and you're signing off on forms giving people permission to take tissue samples, and these biotech companies are benefiting from them, and maybe even pioneering new medicines. But you, who gave your consent for them to utilize your tissues, don't get the benefit of that in any way, not even in the form of innovative medicines. So yeah, there's definitely a disconnect there, and I hope you enjoyed what she had to say about that subject. We're going to invite Yinka up to the stage, our founder, and just talk about what else we have to offer this week.
Yeah. Well, first, I want to say I knew Dr. Marielle Gross will definitely wow everybody, right? Because I had the privilege of connecting with her a long time ago, and we've been talking about her research. And, it's something that's very dear to me as well. Lost a couple of people to cancer, but also having been someone with medical history as well, the impact that this research that she's doing to the patient's health can definitely be significant, right? The impact to medicine as we know it, right? This is like this, she's charting a whole new pathway for how people approach medicine, which is weird because we've gone years assuming that one needs to de-identify an individual in order to have the quote unquote right type of research. But now, with her research, it's bringing a, a lot of questions, right? Of in regards to how things are being conducted in medicine, period. And it's also feeding into the ecosystem that we're building, which is your data is important, right? And your ultimate data, your DNA, should be the one that you could capitalize on. And when things do happen, or may happen, I should say, you need to be able to be on that path of receiving breakthroughs based on your research, you
Absolutely.
know. And that's powerful, right? Because there's so many different research out there. But when they give us drug, as she's mentioned, it's basically, a hit or miss, right? Because it's not based off of your cells, right? So they work, the research works in I guess a general um, population concept, right? If we find a breakthrough, it should work for a certain percentage of the population. But imagine finding a breakthrough that essentially works for you, for you. It ties back to you because it's built based off of your ultimate DNA, and you're reaping the benefit of that, and not only you, the generations after you, right? Because we know oftentimes cancer is often something that other generations may encounter as well, right? So now that there's this breakthrough that my DNA was used to facilitate, now I know that I'm leaving a legacy behind that so it's not just financial, it's powerful than that, right? Now you're leaving something else behind to take care of that next generation. And okay. I mean,
Absolutely. Yeah. And as Dr. Mario pointed out, it's a genetic disease. So, if your cells can benefit in terms of creating this breakthrough medicine, and later on down the line, there's a relative that suffers from
mhm,
the same impact. I mean, just like you said, it's mind blowing what the possibilities are. You've helped not only, uh, the overall, population, but people that are near and dear to you that may develop this disease as well. And it's a powerful thing. And again, I definitely want to point out, especially as we look at communities of color, and we all know, when we look at the statistics, because of the stress of just being Black in America, we suffer from a variety of diseases, high blood pressure,
mhm,
cancer, diabetes, all of that. So we're constantly in doctors' offices, and when we look at the statistics around the subpar care that we get as minorities, and then probably double that when you talk about minority women,
mhm,
it's absolutely mind-boggling. So to have a research project that focuses on humanizing what we do in medicine, it makes a difference. Because I think I did a paper my last semester in college about AI technology, and even how they had found that AI technology was biased. There was implicit bias based on the way it was being programmed, because it's programmed by human beings
yes.
who have certain beliefs and certain whether they be erroneous or not,
Mhm,
about Black folk, and how our care should look, and how that is done. So we got to start putting the faces back, as she made so powerful with those pictures worth 1,000 words. We got to start putting the faces back and seeing medicine has to see us not as test subjects, not as human guinea pigs, but as real, flesh and blood human beings, that are no different than they are, with the same, feelings, emotions, and um, wants, desires, goals that they have. And once, if we can do that, that's why this work is so powerful that she's doing. We will change medicine as we know it forever, and not just bio research.
yes, not just bio research, man. Ooh, I can't wait to live in that type of world. I'm telling you right now. I know, a lot of people are thinking so much about, how this NFT can really impact what we're doing. And this is a glimpse, right, of what's to come, right? It's going to be far beyond the artists, utilizing it for their own benefit, and more so, other industries tapping into it and utilizing it. And I, for one, am very excited about how healthcare and medicine is going to start utilizing this blockchain technology to strengthen and to also involve, right, us as humans in the outcome, right, and also give more care to us as humans. And that's what we really want to work towards, right? We want to work towards not only us having, our data, but also using our data in an effective way, right? And reaping the benefit. And it doesn't always have to be monetary, right? But reaping the right type of benefits from our data being out there. And I think, her research is going to lead the way for that, and I'm excited.
Yeah, I certainly hope so. I think another thing is humanizing patients
Mm,
brings back the trust factor.
yes.
And particularly in communities of color, that is the thing that is so missing. We all know about the infamous Tuskegee
Mm,
experiment, which has impacted the way that we interact with healthcare for a very, very long time. Um, it, the Henrietta Lack story that she shared, all of these things could be changed and would make a difference if we could, just meet that disconnect,
mm.
the gap is huge. I am going to bring Dr. Mariel back because she's still here, and I want her to get in on this
Yes.
conversation. And thank you, because we know how valuable your time is. Thanks for being
Mhm.
here. I want you to weigh in on this conversation that Yink and I are having.
Yeah, I was going to ask. Oh, sorry. I'm still here. Inside the Cathedral of Learning here. Um, you know, I could show some images of the organoids that I think might be of interest because we really didn't get to delve into that. But you're gonna have to bear with me as I clunkily try to do this.
No problem.
Let's see.
So you mentioned, these organoids, they're living organisms, right? And you mentioned that they're 3D. Can you go into, like, I guess, a little bit more understanding or definition or insight into what they are, right?
Can
And
you see this
how they
the full
benefit.
screen?
I'm going to add it to
It's
the
coming
stream,
up.
and yes, we
Okay.
can. Mhm.
Okay. Cool. Yeah. So this is an example of an organoid. It was a black and white photo taken where you can almost see the texture of it, right? Where these parts in the background are in the distance, and these parts are closer up. And you can imagine it's occurring at different depths. Um, Here's another version where we have some effects on the images to.
So, Doctor, you're sharing your file manager.
Oh,
Are
not this.
you sharing the slides individually?
Yeah, sorry, I was supposed to bear with me with that.
No
Maybe I didn't do
problem.
that right. How do I do that?
Uh, are you
Undo?
using two monitors?
No.
Okay. All right. It should go ahead and share your screen. It should pop up.
All right, let's try this.
Oh, open the image first.
What happens if I go? Do you come with me?
Nope.
Nope. Okay, never mind. Well, we'll have to leave people hanging on that one then, and we'll just we'll say that I have some really awesome images of the organoids. The way that it works is that the patient's tumor is taken to the laboratory. After it goes to the pathology laboratory, it's taken for clinical purposes first. And then if they had agreed to be part of the research, the patient is really identified before their surgery by the researchers because they want to take that tissue in what's called, this might be a little ick factor, but fresh.
Hmm.
And while it's alive, right? Because these are living models. And so they take them while they're living, they break them down, and then they suspend them in a gel. And then they allow them to they self-organize and they grow. And that's why the role of imaging is so important and why it's such a great images are obviously the well demonstrated use case for NFT technology. And so simply just, taking the photos of these organoids, which already exist from the research itself, it becomes this source of personally meaningful value that we can return to patients and provide them with both transparency as to what the nature of their own specific contribution is, but then also through that transparency, open the door to future engagement, and then ultimately to the accountability that we know people deserve. I think, my question to you all and to the audience is, as it were, patients are not on Discord, mostly, right? How do we bring this to be something that we can return value to the patients today? Not just like the elite, most advanced patients, but, our grandmothers and their, unsavvy friends.
Yes. I mean, my thoughts there are this, if I was dying, or even, the possibility of death, which cancer definitely brings us face to face with our mortality. One of the things that I think everybody wants to know is, what legacy it is that they're leaving. What in your life is it that you've done that made the world a better place? For you to be able to share this information with patients, that what they are offering, their living tissue, is making a difference, impacting the world in a positive way, that in and of itself is a huge and powerful gift
It is.
that we could give to someone facing this. And, that's priceless. To me, that's a big, big factor here.
It is. It is.
Do you think that the patient's family members are going to be super key for that?
Absolutely. Understanding, like you said, the family's there anyway. If
Mhm.
that patient is lucky enough to have that kind of support, having the family, be a part of this. Like I said, if there was a possibility of a person receiving an NFT from the start of their care that goes all the way through to whatever the outcome of that care is, and then having the family involved in that even beyond, and saying to them that there's the potential for this research to to help so many others, and hopefully then help the patient themselves who the cells came from. And then after that, there's the ability to monetize this so that we can help offset some of the cost of this care. And even beyond that, because once a person is diagnosed with something terminal, obviously the financial impact is huge. And the burden on that family is huge. And again, take that with people of color and or women who make less money than their male counterparts, Black women who make even less money than their white female counterparts. Then you get the picture here. So those kinds of things can change lives, can change the trajectory of someone's family's life, and can just alleviate a lot of unnecessary suffering if those things were possible.
What do you think about the, there's a problem because, right, I think patients today start with that intrinsic motivation that you mentioned, right? That we talked about first, the personal benefit of self-knowledge of what is being done with your own tissue and what the nature of your own impact is. And many times it's not going to go beyond that, right? Like
Yeah.
the goal is for it to go beyond that, but for many people that might never occur. Some of the pushback or some of the kind of challenges, I think, how do we navigate this in a way where we say, look, the point is not commercialization.
Right.
The point is continuity of care, respect for you as an individual, as a contributor, and as a beneficiary to whom we owe something. Now, if one of those things is commercial benefits, then I think that's like it's not the point, but if it happens, you certainly deserve to be part of it. And how do we kind of prevent that fear and distrust related to that exploitation and the current way that things are done from, like some people are like, oh, is this going to make people give less to research?
Yeah, I hear what you're saying there. And again, and I can only speak from my own personal experience as a Black woman in the healthcare system. The trust factor is a difficult one
You know,
because of all the history.
This is going to be a deep debate and well, not a debate, but a discussion, right? Where we can go on for days on this particular topic. Dr. Gross, I would love to have you back later on today. We can do Ask Me Anything session in our Discord, as well as we will hybrid into Clubhouse and Twitter. Please join us. Let's schedule it for 1 p.m. Eastern Standard Time, and we will continue this discussion. Corey, I know you have another speaker that's about to come up, so why don't you go ahead?
Thanks,
Thank you,
everyone.
Dr. Ross.
Thanks, Doc. You guys, we will continue our Table Talk Thursdays here with some more honored guests. I'm going to be bringing to the stage Renaissance and Marie. I believe Renaissance, are you here? Hi. And there's Marie. Um, Renaissance acting in a translator role where necessary or if necessary. Am I correct there, Renaissance? Oh, you'll have to unmute Renaissance. Oh, there
Can
you
you
go.
ask the question again, please?
No problem. I said, hi, how are
Yes.
you?
Do you
And are
understand
you
me?
here? Yeah, I can hear you. I can hear you. Are you here, Renaissance, kind of acting as a translator today if necessary?
Yes, because I am not
Awesome.
very, very good in English, so I mean on Renaissance to translate.
Absolutely. So, you guys, I am going to let our next guests introduce themselves and talk about their contribution to the blockchain. And I'm going to allow Renaissance. Did you want to do that for Marie, or Marie, did you want to do that for yourself?
So no, Marie can do it for herself. We're just trying to share her presentation, and there
Okay.
seems to be some issues. But Marie can do that while I'm working to figure that out.
Okay, Marie, tell us about yourself. All right, Marie froze on us just
Marie.
for a minute.
Okay. I am Marie Kingonda. I am Cameroonians who live in. Her name is Marie, and she is from Cameroon. Do you?
And you guys bear with us because we have people on from all around the globe, and sometimes we get a little lag with our communication here. So just bear with us. Marie, can you hear me?
Yes, I hear you.
Okay, go ahead and I'm sorry, continue. There's just a little
So
bit of a lag
I
with
am
your intro.
Cameroonian, and
Okay, Marie, you're freezing. Your picture's
okay.
freezing on us, and we can't really hear you.
I live in France, and I am a social entrepreneur. I don't understand. Renaissance. I don't understand. I have to make my presentation direct now. So you're freezing, Marie? You're freezing. Because I don't. I have to speak French. I'm happy to be here because I am a blockchain entrepreneur in France. I am from Africa, in Cameroon, Central Africa. So I want to present you about the use of blockchain for empowering women.
So she wants to be able to present to us the differences of being a woman working in blockchain in a predominantly male industry. However,
Do you
we're
understand
having
me?
some.
You're breaking up a bit. Like we can hear you, but you're in and out.
Hi. What is? Okay. Don't. Do you understand?
Um,
Techniquement, il y a un problème. Do you understand me? Because me, I don't understand you.
You guys bear with us as we try to work through these little technical issues.
is it possible to maybe pull her up on like WhatsApp? And then you guys can hear her speak from my computer, maybe?
Mm-hmm. No?
We'll let the production event team try to work that out. Hold on one second.
Okay, I'm gonna leave and come back and see if. Give me 1 second. I'm be right back.
Very good.
Thanks. I don't understand. Hi, do you understand me?
Yeah, I can hear you now.
Okay, good. So I can make my presentation now.
I know they're trying to work on getting your slides, but go ahead and speak and reintroduce yourself if you would.
Okay. So I have my presentation to make. I am looking on the Marie-Eloge. I am social tech entrepreneur who use the blockchain as impact in women entrepreneurial. Of Kinji, a blockchain application in France.
Marie, still there?
Okay. So I want to make my presentation for the International Women Chain. Renaissance, are you okay?
I'm here. Voilà. Vos présentations est uploading. So, 1 second. Est-ce que tu fais
Because
vos
I will speak in
introductions?
French because I need to. I am already make my introduction. Thanks. So, blockchain empowering women. So, it is my presentation for this day. In the slide, good for women who make entrepreneurships. I make this presentation in honor of all fighters because women have to fight to be equal with men. Alors, let's dive in access to finance for women. And the second tips, it is about the performance of blockchain. So what is my presentation? You can find me in LinkedIn with my name, Marie Ngolo, and on Twitter, FinTech for African. Where are women business? Because you have in the March Equal Day and Day of Right of Women, but we lack a lot of tips. So I jump in French because, as you see, I am not very good in English, but I tried because I am very, very happy to share my project with women in the world. So the next slide. In French now. 2%, uniquement 2%. Mais de quoi parle-t-on, mesdames?
2%, only 2%, but of what, ladies?
2% sont levés par les startups féminines en France.
2% of funds that are raised by female startup in France are 2%.
Ce qui est incroyable est qu'en plus, elles doivent recevoir 2 fois moins de fonds quand elles sont financées par rapport au projet par des hommes, avec des écarts significatifs dès le premier jour qui s'accentuent par la suite.
What is incredible is that they also receive 2.5 times less funding when they are funded for projects other than by men, with significant gaps for the first round and then onward.
On voit que la rationalité du fameux investisseur sur le risque se fissure, car les partenaires de fonds sont des hommes plus enclins à faire confiance à des hommes.
We see that the rationality of the famous investor on the risk is cracked because the partners of funds are men more inclined to trust. They're more inclined to trust other men.
Slide. L'étude que publie Sista 9, Sista est un collectif de femmes VC et entrepreneuses en partenariat avec le cabinet de conseil BCG.
There was a study published in 2019.
Pointe des inégalités entre hommes et femmes dans l'accès aux levées de fonds.
There was a study published in 2019 by SISTA, which is a collective of women, venture capitalists, and entrepreneurs in partnership with the consulting firm BCG. It points to the inequalities between men and women in access to fundraising.
Il faudra attendre 2090 pour atteindre la parité dans l'entrepreneuriat français.
It would take until 2090 to reach the parity in
dressé par le premier baromètre de Sista. femmes entrepreneurs et investisseuses et de Boston Consulting Group.
And this is the bitter conclusion of the first barometer of SISTA, a collective of women entrepreneurs and investors in the Boston Consulting Group.
Thanks. Car oui, jusqu'à maintenant, l'accès au financement pour les femmes dans l'entrepreneuriat reste une difficulté et important.
Until now, access to funding for women in entrepreneurship, it remains an intense difficulty, and the gender gap funding is important.
Je répète, les femmes ont toujours travaillé.
I repeat, women have always worked.
C'est à partir du 19e siècle que les femmes ont véritablement commencé à travailler hors du cadre familial en tant que marchandes, couturières, nourrisseuses ou infirmières.
It is from the middle of the 19th century that women really started to work outside of the family framework as merchants, seamstresses, and nurses.
Nous sommes dans une époque de travail tertiaire amenant des nouvelles formes de mesure. Et c'est là que ça coince.
We are in the era of territory where work bringing new forms of measurement, and this is where we get stuck.
Alors, on peut voir dans ce graphique que l'entrepreneuriat des femmes coince en termes de proportion. Ce sont les statistiques de l'INSEE, l'Institut national de la statistique et des études économiques en France.
You can see in the graph that women's entrepreneurship is stuck in terms of proportion. There are the statistics from the National Institute of Statistics and Economic Studies in French. This is where that graph is from.
On note une progression pour les micro-entreprises et les entreprises individuelles classiques qui correspond au statut d'indépendant, car elles créent leur propre emploi.
We note the progression of for micro enterprises and classic individual enterprises corresponding to the status of self-employment because they create their own jobs.
Thanks. Les projets portés par les femmes requièrent en général un capital initial plus faible. Ainsi, il nécessite de levées de fonds très importantes car les dispositifs d'aide publique existent et leurs fonds propres suffisent.
Projects led by women in general require less initial capital. Thus, they do not require very significant fundraising because the existing public aid mechanisms and their funds are sufficient.
En France, d'après l'INSEE, 39% des individuels ont été créés par des femmes. Cette proportion est quasi stable depuis 2015, alors qu'elle augmenterait progressivement depuis 30 ans, entre 29% en 1987 et 33% en 2000.
So in France, according to INSEE, which is where this graph was published, 39% of sole proprietorships in 2018 were created by women. And this proportion has been almost stable since 2015, whereas it had been gradually increasing for 30 years.
De manière générale, les entreprises dirigées par les femmes sont plus petites de taille que celles d'hommes.
So in general, women-led companies are smaller than men-led companies.
En revanche, ces entreprises ont en moyenne une rentabilité supérieure de 9% par rapport à celle tenue par les hommes. Enfin, les femmes sont plus enclines à créer des entreprises dans des secteurs porteurs comme dans les domaines de la santé et des services à la personne.
On the other hand, these businesses, they average 9% higher profitability than those owned by men. And finally, women are more likely to start businesses in growth sectors such as health and personal services.
Alors, Arlène Kaplan-Daniel, 1930-2012.
Répétez, s'il vous plaît, Marie.
Alors, ok. Arlène Kaplan-Daniel, née en 1930 et morte en 2012.
This is Arlene Kaplan Daniels. She lived from 1930 until 2012.
Elle est une sociologue connue pour avoir analysé le travail invisible.
She's known for her works in the analysis of invisible work.
Le travail invisible décrit une forme de travail impayé, non rémunéré, des femmes comme tâches bénévoles qui, bien que faisant partie intégrante du fonctionnement de la société, ne sont pas considérées comme du travail et sont culturellement et économiquement dévaluées.
Everything that Marie just said is in this block here. Invisible work that describes the forms of women's unpaid labor like housework and volunteer work that, while integral to the functioning of society, is not regarded as work and is culturally and economically devalued.
Donc, en fait, l'enjeu est de reconnaître le travail hors du cadre familial. Dès que le travail à la maison, déjà que le travail à la maison n'est pas reconnu, ça est considéré un travail invisible, alors il y a une extension sur la perception de celui en création d'entreprise.
The challenge is to recognize work outside of the family. So, you know, you already work at home, which is not recognized, but it's considered an invisible work. So there is an extension to the perception of one's creation of a company.
Malgré leurs contraintes, les femmes sont plus rentables avec moins de financement que les hommes et sont créatrices de richesse. Mais mince, qu'est-ce qui bloque?
Despite their constraints, women are more profitable with less funding than men and are wealth creators. But damn, what's the holdup?
Malgré les embûches comme les contraintes personnelles, les difficultés de financement externe, le manque de soutien ou de reconnaissance, ou bien la faible intégration des femmes dans les réseaux d'affaires.
In spite of obstacles such as personal constraints, external financing issues, lack of support or recognition, poor integration of women business networks. Marie, nous besoin de pour finir. Nous avons 3 minutes.
Ah, mince. Alors,
Oui.
ok, elles ont des bonnes.
I would say, Marie, I would say, talk about your startup. Parlez-vous startup. Oui.
Alors, ma startup, c'est la JAP 14. Kinjay,
Oui.
Kinjay est ma startup. Slide.
Slide 14. Slide 14.
Ok. L'Horoscas System est utilisé par les femmes migrantes africaines afin de faire du financement de leur activité entrepreneuriale en France.
The Rosca system is used by African migrant women to finance their entrepreneurial activity in France.
Une association tournante d'épargne de crédit est un groupe de personnes qui acceptent de se réunir pendant une période définie afin d'épargner et d'emprunter ensemble. Une forme combinée de services bancaires entre pairs et prêts entre pairs.
A rotating savings and loan association, ROSCA, is a group of people who agree to meet for a set period of time to save and borrow together. It's a combined form of peer-to-peer banking, much like the blockchain, peer-to-peer banking and peer-to-peer lending.
Le projet Kinji est sur la digitalisation du système ROSCA au travers d'une application blockchain.
The Kinji project is about the digitalization of the ROSCA system on the blockchain application. Marie, nous avons 1 minute.
Alors, c'est juste pour parler des enjeux de la puissance du calcul. Slide.
Let's allow time for Q&A. Des questions et répondez pour du courrier. Okay. Corey?
Hey there. I had to unmute my mic.
Do you have any questions for Marie?
Yeah, I definitely do. Can we ask her first to provide a way that people can learn more about Kenji and where to contact her?
Okay, you have my email in the next is a final slide. You can contact me in Kinji. The next.
Oh, there.
Yes.
So I see the at Gmail
you have my contact
address. And can you ask Marie also what kind of startups they are backing at this time? What kind of businesses women who are applying are doing?
Okay.
Marie?
It is about inclusion economic of women to make women to create a startup or enterprise. And the use of blockchain make a new paradigm because you have to encourage the performance of blockchain.
All right. I hear you, Marie. Thank you so much. I love the work that you're doing and how important it is in the world.
Thanks.
We are running a little bit behind schedule, so we're going to bring Yinka up here. And you guys saw how to contact Marie. Make sure that you are contacting her at that Gmail address to find out more about Kenji and the work that she is doing in France. Hi, Yinka.
Hi, that was fascinating. I wish we had more time to spend with Marie, but we do encourage her to please post it in Discord, and for you all that are listening to come and check her out in Discord. And, she may be able to join our AMA later on at 1 p.m. Eastern Standard Time. Next, I know that we have another speaker. And we're going to bring up Adorable Jasmine. Adorable has been in this space for a while, and I'm excited to have her with us. Adorable, are you there?
Yes, sorry, I'm getting I was just like in a different mode.
No problem.
Here I am.
Hi.
Hi.
How are you?
I'm well. I'm doing well.
Awesome.
How are you?
Good.
Congratulations on this amazing festival or conference.
Thank you. I really appreciate that. And no, congratulations to you too, because I know you just came off of a really great festival that you did for Black Metafest. So can you talk about that?
Absolutely. Yeah. So we within some Black women, French and Opay, within this kind of, I guess, clubhouse Black NFT metaverse space, we made the connection that it would be very powerful for us to honor our ancestors and have kind of really powerful Web3 conversations within the context of Black History Month. And so 4 months from that date, we began planning weekly on how we would then create space for the Black community to learn about Web3, to learn about NFTs, to learn about the metaverse, and to learn about blockchain technology in a manner that was accessible, that was like in essence a great way to onboard Black people from youth to elders and everyone in between. And so we had a 7-day festival and each day had a different theme. And we were able to give away free NFTs. I think we gave away, I think we gave away about 300 to 400 free NFTs for that event for people just showing up and coming out. And it was really powerful. And at the core of it was around Black wealth and economic empowerment.
Awesome. Awesome. Well, much success to that. I know you guys are already busy working on another festival. So can you talk about that one?
Yeah, so we're going to be doing very similar to the last festival that we did. It's going to be Metaverse Web3 inspired, but it's going to be focused on Juneteenth that's coming up, a day in remembrance of the end of slavery in the Americas. Most people, the end of slavery for most people in America. And the theme that we're invoking is freedom and free, like how when it comes to the metaverse and Web3, how can we leverage these technologies for freedom? What does it look like to experience freedom in these spaces? Financial freedom, social freedom, creative freedom. And so we're really we're creating opportunities for, again, the Black community to come together. We're going to have workshops where young people are teaching again. That was really successful to just have young people come out and teach us about what it is they're doing in Web3. So we're going to be engaging with youth again. And it's just, yeah, it's just as we keep growing as Black Metafest as a community, it's a combination of Deeper Tones Collective, which I'm the founder of, and the Black Metaverse with Stefan and Lachey. And so it's really powerful to kind of, and then all these people are coming, all these amazing community members who believe in this work are coming together and putting forth all of their talents and abilities. So Yinka, it's kind of like what you talk about a lot, which is how we can leverage whatever talent and ability we come from and bring that into the Web3 space.
Awesome. Awesome. Now, I know I kind of jump into asking you questions, but I do want you to take the time to talk about yourself. Why don't you go ahead and introduce who you are in this space?
Absolutely. Thank you. I am Adorable Jasmine. You could just call me Adorable. And that's, every time people find out my name is Adorable, it's a thing. And so that's my name. And I for many years lived in the Bay Area, and a lot of my work was centered around social impact work, mostly working within the food justice spectrum. I did a lot of youth leadership development. And a couple of years ago, I made a transition into tech, into civic tech, namely. And then over the course of a couple of years, I just became so enthralled and fascinated with Web3 and the abilities for Web3 to create systemic change. But I also still felt very much the inability to access it. I myself am not technical. I'm a product manager and a project/project manager, and that's the kind of lane I operate in. But I could still sense that there was an opportunity for me to contribute and that I belonged in that space in some regards. And so I founded Deeper Tones with the hope that there could be a space for Black people, well, within various chapters of their journey within Web3 to come together and to uplift the Black community in getting into the Web3 space. I thought the mission of it being centered around folks of the African diaspora, not just Black Americans, but Black people from around the world, I thought the impetus of it being centered around this community really harkens to the disparities that we see within Black people working in tech, Black people feeling comfortable and understanding concepts like the metaverse and Web3, and that by creating as many Black spaces as possible, that there would be the opportunity for um, us to create change in people's lives, for us to not feel like, as a Black community, that we're not welcomed into this space, and for us to also to think about how we can collaborate, partner, create ownership, create education, or create educational spaces that can lead to people taking the reins and actually helping to define Web3, and in us defining Web3, and us having a seat at the table to help define what this looks like, there being opportunities for us to have jobs, as it is like, and the NFT industry in itself is in 2021, the NFT industry made about $24.9 billion. And that is a lot of money. And that changed a lot of lives and is continuing to change a lot of lives just within the NFT sector, not to mention decentralized finance, the actual technology itself, and kind of building out the technology. And so there are a lot of different ways in which that this movement is so new and so fresh and so young, and clearly as we're seeing, has the wherewithal to be with us probably indefinitely, and that we're seeing actually a change of tide, that Web3 potentially could be the way that a lot of businesses, a lot of mainstream companies are structuring themselves, and that we definitely need as many Black and brown spaces, I would say brown as well, for communities to feel like they can have the understanding as to how to connect with this work. And so that's kind of like a long-winded introduction to me. I'm very much interested in how to align as many connections to this space as possible for Black people in particular, and support other allies in understanding how to connect with this technology as well.
Awesome, awesome. I definitely agree that what is it? Representation does matter, right? And being able to see yourself involved in this space does matter. And that's the goal of the International Women of Blockchain, because we've been told that there's not a lot of us, or there are no women in this space, or it's a male dominated, even the word male dominated space, right? Kind of sets the tone for what the, I guess, expectation of people that you will encounter in this space. So having even a culture or a subcommittee within this ecosystem that specifically caters to Black people, I believe it's important. And I believe, we all should embrace all cultures as well, right? So having the mention there, because I've been inside the mention, having it there and experiencing that was like fantastic. I believe it may have been my first introduction to like a virtual world off of alt space, right? And can you talk about what went into creating the mention, right? And the individuals that help with creating that.
Absolutely. And would it be helpful for me to maybe share my screen to kind of
Yeah,
share?
yes, please.
Okay, awesome. Because sometimes words just can't like express the full depth of it all. So I'm just going to share my screen really quickly. Okay, this is a new platform. Sorry. Okay.
No problem.
I'm sharing my screen now. No? Okay, there we go.
All right, just waiting for it to pop up.
Let me know. Am I sharing my screen now?
Yes, you are.
Okay, awesome. One moment. Technology's doing its thing. I know this is the previous presentation, that was technology. Okay, So, so the Deeper Tones Collective, as I mentioned, that I'm a founder of, something that I knew right away that was really important was that wanting to make sure that there was a space for us to gather virtually that went beyond a Zoom space, that went beyond just a Clubhouse space, but a metaverse space, I should say, that people could connect with. And what that does is and so we created this space called the Deeper Tones Mansion. The Deeper Tones Mansion was built by Artsy. She is a Black world builder, Black female world builder in alt space. And the mansion that you're seeing, I gave her this impetus for a project that I'll talk about in a little bit called the Black Money Project. Sorry, I guess there's a little bit of glitchies in here. That was funny. Okay, sorry about that. Okay, so this mansion serves as both a meeting space and a gallery. These images that you're seeing are images of a gallery of Black Metafest. We had Web3 Wednesday for the past. We were mentioning this Black History Month festival that we did for Black Metafest. So Wednesday was Web3 Wednesday, and it was held at the Deeper Tones Mansion. And the art that's up on the wall happened to all be art of Black women. It just worked out that way. We had one of the NFT projects that is connected to this mansion, the Black Money Project. They got to vote. The collectors got to vote on which art would go up into the mansion. And so the art that you're seeing are from some lovely, phenomenal artists that handmade all of these beautiful images. These are all NFT projects that are being displayed here for people to walk through and check out. And so we have, as you can see, just some phenomenal, there's Kamaya here with her Afrofuturism work. Just some lovely work that connects to her identity and kind of showcasing Black people as it relates to us existing in the future. Her connecting us to just what's inside of her mind, this feeling of creativity, and how we can turn that into art and into opportunities to support oneself. We have just beautiful throughout the mansion. We just have some lovely images of Black art that are displayed that people can connect with. Yink, I had no idea this was your first time going into alt space, so that's such a huge wonderful thing to hear, that the mansion was the thing that you were introduced to.
Yeah. It was fantastic. It was a different feel, right? And it lived to every expectation that I had. And knowing that Artsy, she really dedicated the time. I mean, she's a wonderful world builder. I mean, there's nothing that you can't say about Artsy that isn't positive and true, right? She has the craft, she has the gift, and just looking at the images right now of this mansion, it's just beautiful. It's fantastic. I love it.
Yeah, no, and she put it together. I gave her free range. I just, the thing that I described is what you see on the screen here. So for the Deeper Tones Collective, one of the first projects that I myself, in activating it, focused was that there had to be an organization, and then the organization could have various NFT projects, of which Deeper Tones is like the umbrella of all of these amazing projects that are featured by Black artists. And I myself am an NFT artist, and so the work that you're seeing in front of you is an NFT project that I created called Black Money, and it's a digital collage project. And so this project right here, Black Money, is featured in the mansion, and it's really just a project that's connected to my, being so new in the space. I also felt like there was this need to like learn and learn by doing. I think sometimes I know I can get analysis paralysis, where I'm like, I don't know if I can do this. I know maybe there's some people out there listening who've considered being an NFT artist. I just want to encourage you to just go for it. You're going to make mistakes. I made a lot of them, but it's still so important to just put yourself out there and learn about the process by doing. And so I created this NFT project, Black Money, with this just watching just the fact that a couple of different things. One, that there was attempts to put Harriet Tubman on the $20 bill, but it never happened. I was seeing NFT projects that I didn't really kind of relate to. And I wanted to create a project that was just that any kind of just that would be inspirational for the Black community, that Black people be like, okay, I don't know what an NFT is, but I like that, and I would want to be a part of that. And so I created Black Money, and it's been a really beautiful project. It's been something that has just changed my life, and changed my awareness around what's possible within the Black NFT space. And a lot of people would say that Black NFT art, compared to other NFT art, or namely white NFT art, that it's less valued. And so the running hypothesis that I have is that Black NFT art is very valuable, and that we can create movements and change just by simply expressing art that really reflects our identity and our culture. And that there's a powerful statement around, for me, reclaiming what initially has a lot of pain and hurt, which is what's on our money right now, namely slaveholders. And like how and I mean, for me, I'm not like a real radical person, but it's just a fact. It's just a fact that our money in the USA has slaveholders on it. And what we put on our money is a reflection of who we are as a people. And so my project is really concerned around telling the story of Black history by minting it on the blockchain forever, and creating the opportunity for us to just this apple, um, this apple that's following me. But by creating this opportunity for us to connect with our ancestry, creating financial opportunities, generational wealth, and bringing forth just opportunities for us to create NFTs, in NFT communities where people are know that the other folks that are in that community have a shared experience. And so NFTs as like a social connection point for people to have shared experiences is powerful. And so the last two things I would share about the Deeper Tones Collective is that we're always growing, and that we're gearing up for another NFT project soon, collaborations between the Black History DAO, which is super exciting. Opportunities for us to feature, at our mansion, we feature panelists that are talking and speaking about Web3, and just the power of being able, I know when Yinka was there, being able to go up to Yinka in her avatar body. Yinka and I don't live close to each other. A lot of people that I've met in the NFT, in the Black Web3 community, we're spread out, maybe even internationally as well. And there's something really powerful about being able to go up to someone and hug them, and have that connection and have that conversation in the metaverse, versus just maybe seeing someone on Zoom. There's something interesting about getting into a headset and having a feeling of being able to approach someone, especially in these times, as we're still, we're still navigating the ability for America to open up and to be able to connect more deeply to people. And yeah, just like what this builds is community. It builds community. It builds collaborations between people who maybe would never meet in real life. And it breaks down the boundaries that potentially can keep people from connecting, Black people within the Web3 community from connecting and building. And so I'm really proud of Deeper Tones, the Black Money Project, and the next projects, and all of the different artists and community builders who are pouring into and leaning into the Black Web3 movement for us to have just opportunities for growth within this space, because we belong here. And
Oh, for
one of
sure.
my favorite companies, Bitwise, that I got trained in says, no one belongs here more than you. And
Mm,
that's a mantra that I take with me wherever I go.
I love it. No one belongs here more than you. That's fantastic. Now, if people want to connect with you, because I know we've had some people who were part of the events at the mention, and they want to connect with you, how can they connect with you?
Yeah, absolutely. So I'm on Twitter under adorbs_disrupts. I'm in the Discord for Black women in blockchain. I'm in the Discord, and I can also my email is Deeper Tones NFTs. And someone said, "How can we get those NFTs in the chat?" You can just reach out to me. Definitely. I see you, Corey. Thank you for that. You can reach out to me. Oh, sorry. Yes, Nicole. It's Deeper Tones NFT at gmail.com. And I should have put that in the end of my presentation, but
That's
sometimes
okay.
we don't.
We will blast it out and make sure that it's also available in the Discord. I would love for you to join us at in about an hour and a half for us to do another segment on Discord and Clubhouse, just to do a recap of today's event. We would love for you to continue providing more information. So thank you very much, Adorable. Really appreciate you jumping on and presenting the work that you're bringing to this space and you're doing in this space as well.
Thank you, Yinka. Thank you for having me. And thank you, everyone who organized this. This is phenomenal.
Thank you. All right, I'm going to bring Corey up. Corey, you're muted.
That last presentation was amazing. I love that Black Money NFT. I've got to have it. Thank you, Adorable Jasmine. I also love your name. Oh my
Yeah.
God. That is amazing. And I definitely look forward to learning more about her project. You guys, we are running a bit behind schedule, so I'm going to, without further ado, bring our next speakers to the stage. We have Michelle Neitz, and I hope I am pronouncing that last name correctly, but if not, please forgive me. I'm just
You
gonna.
are.
Am I? Am I
Yes,
good? Okay.
you are. You're good.
Yay! Miss Neitz is a professor of law at Golden State University School of Law, and she's also the founding director of the Blockchain Law School or the Blockchain Law for Social Good Center. I love that, and I can't wait to find out what that is about. And I know that you have also advised the California legislator on blockchain and its use cases.
That's right. And I have a student of mine who's about to graduate waiting backstage who I hope we can bring up. There she is. NECA, thank you so much for joining today. You can tell it's a foggy morning here in San Francisco. And so I would like this to be a conversation about how blockchain leaders can support those who are coming up in this space. And Corey, if it's okay with you, I'll ask NECA to introduce herself first, if you don't mind.
Absolutely. Hi, NECA.
Hi, good morning. My name is Neka Aguilar, and I'm a 3L at Golden Gate University. I have gotten involved in blockchain through Professor Neitz. I took blockchain last spring, and needless to say, got kind of addicted to it and learning about it, and was able to get a position at I think it's considered an exchange last summer, and it was great. I learned so much, and I'm excited to share kind of what helped me learn and what helped me feel more open to learning. So I'm excited to be a part of this conversation today.
Amazing. Because I think a lot of the things that we don't talk about, especially as women in this space, is what the opportunities are. Because blockchain is this big, mysterious, for many of us, I will call them the normies who don't live inside the echo chamber that we do. It's this kind of undefinable. What is this? It's technology? It sounds like it's for nerds. So can you break down the mystery of that for us a little bit?
Sure, I'm happy to take that. I've been teaching blockchain law for 3 years. I'm still the first and only professor of law in San Francisco to teach this class, which is sort of shocking, really.
Yes.
It's growing. There's a growing movement of law professors and some amazing women law professors in this space, actually, who have convinced their law schools that this is a valid addition to their curriculum and that we should be teaching this to law students. And I think that the most important thing I've learned in dealing with this is in teaching this is to acknowledge upfront that it's a high learning curve and it's intimidating. And so, because when students walk into my class on the first day, they've told me later, oh my God, I'm so nervous. I don't know anything about technology. I don't know if this is for me. She said you don't have to know about technology to join this class, but I'm not sure about it. I had someone say that to me yesterday, actually. And so it needs to be accessible. We need to focus less on jargon and more on just distilling this down to what decentralized technologies actually are. And I think what helps lawyers and what I've learned helps legislators and regulators is to say you don't have to know how to code. Of course, it's useful, right? It would be really helpful if we could all go to a coding boot camp and be able to create a smart contract on our own or know how to mint an NFT. And I would advise attorneys in this space, if you have nobody has the time, but if you had the time, that's a really useful thing to do. And so that's something that I think I'd really try to show folks is that it's for lawyers, it's important to know what this can do and the opportunities that this will present to you and your clients. And don't be intimidated by the fact that you may not know how to code. Naka is actually my teaching assistant this semester. She did so well in my class that I invited her to be my teaching assistant. And so, Naka, I'll ask you, how did you feel coming into this when you first arrived?
Yeah, coming into the class, I felt like I didn't really know, honestly, what I was getting myself into in a good way, because I was just advised by a friend that it's something that maybe I should take and that it would be interesting. But when I got into it and did the first readings for class, I was like, whoa, this is a lot more tech-based than I thought. I like it. I feel like I'm understanding it, but I'm not tech savvy. So for me, that was the first thought that I kind of had to fight off a lot was I'm not tech savvy. I barely know how to work my computer. How do I make sure that I'm learning how to understand and use these technologies that felt so completely new to me that it's almost like comparable to how the metaverse sounds to me right now, where I'm still learning about it. It's so like almost trying to wrap my head around it is something that's just a concept in and of itself. So for me, I felt like when you told me you don't have to code, that was the biggest relief. But I also felt like while I was learning it, there's so much information on YouTube, just on different articles that have been posted that you can kind of self-teach too to make it more accessible. And when I took on my job at CoinList, it was really nice to have people who were so experienced and had so much more knowledge than I did at the time, who were really open to just questions. And I feel like I can say that about Professor Neitz as well. Any and all questions, I needed to feel like no matter how dumb I felt asking, I needed to be able to get it out because it was something that I couldn't stop thinking about. So having people who are just really open and willing to almost mentor you through your journey and just learning it is what really helped me figure out, okay, this is a steep learning curve, but this is something that I can definitely take on and handle.
Yeah, I like to tell women, especially, because we multitask, we're so savvy in so many different things. Once you commit to putting in the effort to learn this, it's like it's
Mhm.
an empowerment. You really are learning like a whole new language, a whole new skill set. And you're adding that to your knowledge base, and that in itself is so empowering. Did you kind of feel that way, Nika?
Yes. And as you're saying that, I want to like clap just because that's exactly how I felt. It was for me the most empowering thing, and just on a personal level, that time in law school when I joined that class was kind of that time where I think everybody goes through, I don't really know what I'm doing. Is this the right thing? Like, am I smart enough to conquer this? That when I started catching on, this was the first class that like turned that journey around for me. That was, I'm meant to be here. Like those were the thoughts that started filling my head just by being able to understand what I was learning. And it was completely empowering. And it did make me feel like, okay, like I really want to see where this goes next. And the fact that I understand this is mind blowing to me, but I'm not going to just let it go now. So,
Absolutely. Those paths along which this can lead really have their limitless potential. And Professor Neitz, I know you probably know that better than anyone. Currently, what's going on, because I see that, we talked about you advising the California legislature on blockchain and its uses. We really need you out here right now. When we see the headlines, we see people like Elizabeth Warren, Christina Lagarde, that used to be with the International Monetary Fund, basically making statements that make it very clear that they do not understand blockchain, how it works, or what its potential can be to uplift so many. How do you reach folks like that, or is it possible?
Well, it's definitely possible. I think people really want to learn. This is actually the reason I created this center, because after working with the California legislature, there are so many awesome use cases that I had never even thought about that came up in the context of creating that working group report, which is online if folks want to see how California was thinking about this. And I decided we need to do something. It was last summer, right? With this whole conversation going on in Congress, that we need to do something to try to show folks that there is more socially beneficial potential to this technology, that it's not just crypto scams. And so the Algorand Foundation actually gave us the funding to start this center. And we launched in February. And I've been told by multiple government agencies and legislative staff, including Nancy Pelosi's staff, I'm her constituent, and I talk to her aides, and they're saying the only people we hear from are sort of the pro-industry folks, right, who are coming in saying don't regulate us at all, and that's not an effective approach with legislators, right? And so like this afternoon, I'm actually going to be talking to the CFTC about an upcoming white paper that they're doing on digital assets, because they need a neutral academic voice to explain what the technology is. And so what I'm trying to offer to regulators through the Blockchain for Social Good Center, Blockchain Law for Social Good Center, I should say, that's important only because we're the first of its kind in the United States. And I don't know of anyone else doing this, combining blockchain and law and social good. You get 2 out of the 3, but it's hard to find all 3. And that's why I built it, because I said, we need, NECA is helping me actually with this center. And so when I talk to regulators, I'm learning. I just presented to the California Office of Financial Tech Innovation. And I was ready to dive into, here are the things, the use cases that are really critical. And they said, could you just do an introduction? Just tell us what it is. So that's what I did. I did an introduction. We had almost 200 people attend a voluntary training because the hunger is there. Government staff want to learn about this. The problem is that the voices that are jumping into the media narrative are the voices of concern and not the voices of opportunity and potential. And so that's what we're trying to do with our center, is to change that narrative. We're doing it in different ways. We're going to be doing lots of events on campus and on Zoom. I'm training government agencies. I'm, really working hopefully to get into talking to legislative staff soon. And showing that this is not something that's threatening. There are aspects of everything that is threatening. There are aspects of cash that is threatening, right?
Oh, yeah.
But this has an opportunity, especially for folks who have been left out of the traditional financial system. And what I tell government agencies is, I just don't want you to throw out the baby with the bathwater here. And in your attempt to create public protection schemes, you're missing the chance for innovation and opportunity.
Absolutely. And I know I live in the DC area, and we have an upcoming march on April 4th for Black and Latino folks who are into blockchain and NFTs and crypto in particular, to, basically go and make those concerns be heard. And it's so key. So you mentioned the combination of law, blockchain law, and social good. Tell us more about the social good that you guys are working on doing in the world.
Yeah, so NECA is about to help us with us being, our team of 2 or 3, or now we have we have more students, so we have more people, and we're looking for more funding so that we can expand. But we're really looking at, let's find the social impact projects that are working, right? Because I've had legislative staff say to me, everybody says that, blockchain creates financial inclusion, but we never actually see examples of it happening. And I thought, there's so many examples of how this could work. So we're using our blog and social media to post Tuesday project spotlights, where we're basically finding projects that are working and trying to amplify them so that legislators and regulators can see that it's actually working. And then NECA, maybe if you want to talk about what we're doing on campus, and we're hoping to expand to the public and to alums, some of the events that we're trying to put together.
Yeah, on April 11th, we're doing, I believe it's like a intro to blockchain, just open to the student base to be able to just attend an hour long. What is blockchain? Getting an idea of how you can get involved in it, what the classes are going to look like, and things like that. So I'm actually really excited about that because for me, just the impact that that class has made personally on my life is where I think so many students have no idea what's going to hit them as soon as they open that door. So on campus, I think we're just raising a lot of awareness about why it's important to take it seriously, and why it's important to be open to learning something completely new and something that might not be the traditional idea of going into law, but it's something that is necessary and vital moving forward. Because I mean, it's here, and it's something that as lawyers we need to know about. And in my opinion, we really need to know about this, because if we don't, we could be doing our clients a disservice in a complete area that matters. And for me especially, that's really important, and that's something that I had no idea coming to law school could even be a career path. So I definitely think that letting more students know is going to lead to kind of our communities, and we should be leaders in our communities. And if we are trying to inspire the people in our communities to learn more about it, I just think that that's going to have a ripple effect. So on campus, we do have a few events going on. We have the class, and then I believe the April 11th event is the first one coming up. And in October, we have the blockchain conference. Please correct me there, Professor Neitz. That one you might want to take over for.
Sure, of course. So part of our funding from the Algorand Foundation included funds for a national conference. And so we're putting together now, who will our speakers be? We've actually been approached by the Bar Association of San Francisco. They want to co-sponsor it with us and bring more lawyers to this, because lawyers are also hungry for this knowledge. And I will say, I really want to thank my university and my law school administrators, because they're letting me run with this, which has been so fun for me. I mean, you can see how much I love my job. Look at NECA, like incredible, And so what we're doing next week in class is we've invited some San Francisco State information technology students, some undergraduate students who have been working on an NFT project and have been interviewing artists about, like, what are your barriers to minting NFTs? They intended to ask them about technical barriers, but their professor told me, actually, we've run into lots of legal questions around copyright, and will I lose the rights to my work if I mint this? And so we're doing a joint workshop, which I think is the first that's ever happened between law students and undergraduate students on the legal issues around NFTs. And we have a couple of attorneys from a law firm in San Francisco called Seidman Bancroft, who are going to be coming to our class to advise us. They can't give direct legal advice, but they can at least tell us what some of these issues are and give some warnings for artists about, here are some things you can do in order to make sure that your art is protected. So there's a real role for lawyers in the NFT world, in the DAO world, and every semester I teach something new. It's really fun for me. Last year I had a guest lecturer cancel, and I had 5 days, and I said, we're going to learn NFTs. And I just went down the rabbit hole for 5 days, so it's a lot of fun. I've been teaching 16 years, and this is really the most fun thing I've done.
You guys hear that? This actually is fun. Yes, there is a steep learning curve. Yes, you have to put in the effort, but it is so worth it. And I'm like you, look at NECA. to see we had the previous guest we had on, Dr. Gross, who talked about the dehumanization that happens in medical care, but that happens everywhere. So when we can put names and faces, and these legislators can actually see the lives that have been touched by this and have been impacted in such a positive way and transformed forever. And how can you not, understand? And I think that's what they're lacking. They're looking at numbers and they're looking at statistics, but those numbers have no names, no faces, no personal stories attached to them. So the work that you guys are doing is invaluable out there. And because this is such a very new digital asset class, I mean, we don't even know what's going to happen with taxes with this. I mean, everything is just like so up in the air. We definitely need lawyers to get involved across the board. And you mentioned DAO structures. Is that something that's pretty prominent or becoming prevalent there in California area?
Oh yes, we're the Bay Area, right? So like we are in the base of innovation, we feel like, is here. And we invite lawyers to come and talk to us about what are the issues that you're seeing out in practice. And so we just had Ben Bartlett, who's a Berkeley City Council member and the founder of a firm, come and tell us what's going on in practice. And to be honest, he's sort of like, he was telling us stuff that I would never have thought of that innovators are coming up with, like using NFTs in proof of stake, like just stuff that, we were all kind of like, the students are looking at me and I'm thinking, I don't know either. I don't know what the law is around this. Like, don't look at me. And I thought to myself, next year I'm going to have to do full courses on DAO governance, how to create DAO structure. And this is going to be a whole class next year, right?
This is so exciting. You guys are pioneers and you literally get to create as you go along. How does that feel?
Well, Neka, you've been a student and now a TA in it. So what do you think?
I think it's really fun. The main part of the class that is your focus for your deliverable at the end of the semester is you write a paper and you do a presentation on a topic for blockchain use cases. And for me last year, it was the first time that I'm really into fashion and especially luxury fashion brands. And I would like to be a general counsel one day for a luxury fashion brand. But it was fun to be able to tie blockchain into that and see how it could solve some counterfeiting issues and be able to talk about that. And Professor Neitz was like, I didn't know that it was really fun to see how you can learn things and how there's so many different avenues to take, that it's fun to then, like yesterday, she gave me the opportunity to dive back into it again and teach. And for me to be able to go from student to still student, but also able to teach a section now is such a level of growth that it blows my mind every time I think about it, because these cases, just the research that I've done last year, everything felt more of like a hypothetical and maybe one day this will happen, or this could happen maybe this way. And now to see just the growth that's been attained in 1 year, it's like this stuff is taking off at a speed that's like a rocket. So, I mean, it's exciting. And there's a lot of consortiums that are out there because people are really starting to believe in it and find its uses valuable. And I just think that it's something that everybody can kind of take their own way of learning it and exploring it and be able to become a teacher in their own way, because everybody has their own interests and those interests are necessary in how we're going to continue to explore this.
Who's your favorite fashion designer, by the way?
Oh, that's really hard. I really, really like Christian Dior. I love the styles. I think they're very elegant and timeless.
Yeah, and I mean, what you're saying is so timely because we see a lot of the big designer brands entering the NFT space now. Dolce & Gabbana, very recently dematerialized, had Rebecca Minkoff and Karl Lagerfeld. So those fashion houses are definitely seeing the value of how they can expand their brands, and they're getting in, and they're going to need people like you. So I
Thank
think
you.
what you're doing is amazing, and it's definitely something that's going to be necessary moving forward. Michelle, and this is a question for both of you guys, and Neka, how would you, go about, I know a lot of what you're doing now is definitely onboarding and educating people, but how can we get more women into the space and interested in blockchain, whether that be law-based or otherwise?
For
Well,
me,
Becca,
oh,
why
sorry.
don't you go first? Yeah, go ahead.
For me personally, I feel like I've seen my impact a little bit just on campus at school because after taking blockchain, I wouldn't stop talking about it. And I kept telling everybody when we were getting ready to take or pick our spring classes, you should take blockchain, you should take blockchain. And I was really open to talking about it and recommending it as more than just like, oh, I know it's your last semester. Like, it's something that you should really learn is more of what I emphasize. Like, you don't want to graduate law school and say that you had the opportunity to take this and you didn't. That it was more of like a gentle push, but it was also something that it's like motivating and exciting because especially as women, like I will say I think I recommended it to almost every girl I met on campus that this is something that you should get into because for me what was empowering was my fiance's very into crypto and it was funny to talk to him about it pre-taking that class and I just had no idea what he was talking about. I was like, is that stuff real? Like, why are you so into it? That once I took the class and was able to kind of now I know more about some things than he does. For me, that was kind of fun. That I just think that having that kind of empowering feeling of I know this is really what I have spoken to, and I feel like that's a huge draw because I don't know a single woman who doesn't wanna feel extremely empowered.
Absolutely, great answer.
That's
Professor
key.
Needs.
So I feel pretty strongly about the need for law schools to expand education in this area. And I think it's especially important for laws like Harvard and Stanford, they're all over this, right? But it's law schools that have classes that are mostly women and who have
Mhm.
very high percentages of first generation college grads and law school grads and students of color. This is where blockchain education really needs to be implemented because that will change the narrative, right? If we've got students who are pipelining into jobs that are able to represent that this is a really fun and accessible industry, I think that will then I think the regulators have to pay attention, right? And so I really commend you, Corey, for going and doing a march, like and saying, look, here we are. We're doing this because what's going to happen is, in addition to the regulators seeing you and the lawmakers, other women are going to see you folks and other people of color will see this and say, wait a minute, maybe this is something that I should get into. I will do a caveat, which is I think that the answer to the how are we going to do public protection in our laws is education. So I'm actually really hoping at some point to expand our center for the Blockchain Law for Social Good Center into high schools
Oh,
and
yeah.
say, like, let's bring my law students into high schools. We're going to talk about NFTs and the legal risks and opportunities. We're going to talk about whether and how you should invest in crypto. Like there's just so much here. And every day I learn something new. I mean, I want to go to Adorable's mansion. I don't know how I really want to get in.
Me too, me too.
Same.
Yeah. So I think that the more we can talk about this and be out there about this, and I see my role as training ambassadors like NECA, who is going to graduate from law school and go on to keep talking about this stuff. That is, I think, the exponential growth that we can see.
Absolutely, and that's going to impact generations moving forward. And I feel like, now that our president, Joe Biden, has signed the executive order, he's basically green lighted this and definitely it always had the credibility as far as we're concerned. But now, for some of the naysayers that were like, this is a trend, it's a bubble, it's a Ponzi scheme, they realize that it's here and it's obviously here to stay. So the work you're doing is absolutely invaluable. And what do you say to people who, because you're from California and I'm sure you've heard it before, that's the hippie state. They're so progressive. They do everything there. And, to maybe the more conservatives among us about blockchain and how valuable it is.
Neka, you should talk
I
about Arizona.
I was gonna say I'm from Arizona and I've definitely dealt with this. For me, I just kind of always say like I'll send you resources, or I really think that it's something that maybe you could read about, or there's videos, and I just talk about it. And I'll, if some people are really pushing back, I'll just say, what is it that you're like really stuck on, or what are you really confused about? I promise you, it's not as confusing as it sounds. And I think just kind of being almost like a, I like to think of it as like ricocheting off. Like I'm not going to let you not think that this is truly something that's worth learning about, because it really is. And even though it sounds crazy, and I tell them that all the time, it sounds crazy. Sounds like it's like this imaginative thing that someone came up with one day, but it's really here and it's really working. And look, this, a lot of times I'll tie it back to brands. Like last year when NFTs were starting, I was like, Gucci made an NFT where you can literally buy these shoes and put them over your feet, even though they're not really there, they're there. That it was more of a fun kind of way to show, like, see, this is really happening. That once people get that real life tied to it, I feel like it makes it more of, why are they doing that? Why would that be important that they would want to charge, I think it was like $75 for digital shoes? That I think it's just more about being kind of being a resource, like always being open to, people are probably going to think you're crazy, but I'd rather people think I'm crazy and then take that as like a learning opportunity than just brushing it off. Because at some point, even if they see it on their news, they're going to think, oh, wow, like that's kind of what they were talking about. That they're inevitably going to run into it now. That I just think it's worth it to at least have some resources kind of in your back pocket, like where you like to read things from, or where you feel like you have found valuable knowledge to share.
Absolutely. And for all the ladies listening, you can all be that resource that NECA is in your neck of the woods, wherever it
Mhm.
happens to be. It's very vitally important that we share this opportunity because it's here now. And the opportunities that are here now won't be here, 5 years from now. And you guys
Mhm.
talked a lot about the creating generational wealth and the impact that this can have, particularly on marginalized communities. Talk to us a little bit more about that.
Well, I will tell you that. So I'm pretty grounded in San Francisco. It's very unlikely I'm a native Californian, right? And so I'm not leaving. But my students are. So yesterday I had a student stay after class, after my ethics class, not my blockchain class, to say, Professor, I'm moving back home to Miami. And I'm really interested in blockchain. And do you think there's anything going on with blockchain in Miami? Which
Ha!
you don't know the answer, right? Like Miami. Right. So now it's okay. Who do I know in Miami that I can connect her to? And then now once if she becomes involved in this, so will her family, right? We all know that, like, as NECA and I will tell you, the family gets sick of hearing about this, right? And so it's exponential as our students graduate and as we start to see more law schools offering this education. We're eventually, hopefully, going to be spreading out. And the way to do that is to have jobs spread out. Right. And so for all that I love the Bay Area and I love that there's so much opportunity here. It's great to see other cities taking on a lead. Right. And so, and people going to Austin and people going to New York and going to all these other places. And maybe eventually it will be going to smaller cities. Wyoming, for example, is a great place to go if you're interested. Yeah. But you're going to run into that same thing you're talking about, a less progressive state, like maybe not in Bitcoin and blockchain, but in crypto. Yeah. But so I do think that I think if every student I educate turns around and educates others, as NECA has done, then I think eventually we're going to start to see this spread, I hope, among the non-Harvard and non-Stanford folks.
I wholeheartedly agree with you. And again, there's no dollar value you could put on that because it absolutely is priceless, because knowledge in any form is definitely power.
Mm-hmm.
How, again, do we continue to spread the word and maybe, influence some of those people, those legislators that, and I'm so happy to hear that you guys are working toward getting in to talk to the legislative staff, because that is so very necessary. I feel like every time I see Elizabeth Warren talking on these issues, and I love her, I actually voted for her uh, when she ran. And I still don't regret the decision yet, but hearing her speak on these issues, I just cringe. Is there any hope for hard cases like her?
Yes, I am hopeful about this, and here's why. I think this is actually I think we're all we're all headed toward the same direction, which is that we want the crypto and blockchain space to grow in an inclusive way that does not harm any particular population, right? I think all legislators are on edge after GameStop, right?
Yeah.
And the GameStop stuff that went on. And so they're nervous about it. But if we can show that you don't need to be nervous, you need to be aware, right? You don't need to think that this is going to spell the demise of our traditional financial system, which in some ways would not be so bad, right? But anyway, what you can say is this is a corollary. That's what was great about the executive order. Although you will notice in Biden's order, the first 3 or 4 words for each of in the fact sheet that they prepare: protect, mitigate risk, and then it's promote innovation, right? And that's the nerves that folks have in government, that if they let this just run free, there will be scams and people taken advantage of. And so where I see it is that right now the pendulum is swinging this way. And my job and the job of our Blockchain Law for Social Good Center is to swing it back, right? And say, look, here's what you're missing. You're forgetting this. If I can get an audience with Elizabeth Warren, I will be so excited to say,
me too.
Thank you for trying to protect us, but here's the other side that you might miss.
Yeah. And to add to that too, I think one thing that I would point to is international policies, how some other countries have completely developed schemes that are working. And I think that if we continue not to be innovative and progressive, we're just going to fall further and further behind. That I just think pointing to countries like even the UK and like where they have these licenses in place and where things are really moving and where they're really willing to at least try things out, I definitely think is worth it. Because yes, there are, like, they can point to, I think they do point to the countries where scams have happened and where millions of dollars have been lost, but they're not pointing to those other countries where, yes, that can happen, but they didn't have these systems set up like these countries did. So I just think it's a lot of being open to honestly being a little wrong and like wanting to get it right. So I think that's
And you guys, I love everything you had to say. This is one of those conversations that I would love to just carry on and on, but we're coming to the end of our time here. Where can people reach you guys to find out about all the wonderful work you're doing?
Well, can I do a plug for the center that just launched actually a month ago? So our Blockchain Law for Social Good Center is on Twitter, BChain, I think it's BChain Law for SG. We're also on LinkedIn, and I am there as Prof. M. Neats on Twitter and also on LinkedIn. And NECA, let's tell folks where to find you.
Yes, I am really active on LinkedIn under NECA Aguilar. I have such a unique name that I have to get lucky and don't really have a lot of mix-ups. And I'm also on Twitter at NECA with 3 A's and an underscore. And I'm happy to talk to whoever is open to it. And it's been so nice to talk to you, Corey. So thank you.
Thanks. I love you guys so much and what you're doing. I'm smiling from ear to ear because I love so much what you're doing, and it's so very necessary. So you guys make sure that you link up with Professor Neats and NECA on Twitter and the social platforms that were mentioned here. And you guys, can't wait to see you again. If you can join us for the AMA, please feel free to do so in the Discord. We'd love to have you for that. And until then, keep doing the great work that you're out there doing.
Thank you, Corey, as well.
Take care, you guys. I'm going to bring Yinka back up to the stage so we can do our wrap up for today.
Hi. Wow. That was a fantastic session. Getting to know NECA and Professor Needs has been fantastic. I love the work that they're doing, and that they're getting involved in onboarding more people into this space through education, through awareness, right? And it's very important because a lot of people tend to enter the space with only you getting familiar with maybe some of the use cases, right? And they tend to stick within their little clusters of friends and information. And so they have an echo chamber around them, right? And it's good that she's expanding that and like building a course that allows law students, right? We need more law professionals who are knowledgeable about this space. Because I know when it first started gaining popularity, a lot of people were confused as to whether it violated the Huey law or whether it didn't. And they were trying to see, does it classify as a security versus not, and there was a lot of information out there, and you had to sort through them to try to figure it out. But to know that people in the law profession are definitely seeing this space as a viable space and getting educated, getting the wealth of knowledge and information that they're looking for, and building upon that to help us, improve this space. I think it's fantastic.
What Professor Needs is doing is absolutely brilliant, and it's genius because she's creating the next generation of blockchain experts that we're going to need, because we just don't have enough people out there. And I think that what I see is oftentimes a lot of ads and job listings that just are waiting to be filled, waiting for folks to be qualified to fill them, that's out there. And as this grows, and it is growing, as NECA mentioned, at the speed of light, we are going to need all of those students that she can get ready and train up for this, because it's about to really get live, especially as we head toward mass adoption.
Yes, yes, yes. And I'm dancing here because we're having the right type of onboarding, the right type of education for law students, right? And so, we're going to have like crusaders, joining this space pretty soon and being like, no, you're all good, and this is the way it really is. And, I can't wait for that. I can't wait for the right type of knowledge and people who are getting their hands dirty and understanding this space and helping us build and helping us cultivate the type of experiences that we want in this space. So kudos to NECA, kudos to Professor Needs, kudos to everything that you're doing. Thank you for joining us today and introducing your course. And, if I was in San Francisco, I think I would be like, can I just walk in? So that would be fantastic. But thank you very much. Corey, you did a fantastic job. This has been another wonderful Table Talk Thursday. I'm really happy that we are able to present this. And even with the technical difficulties, we were able to at least have all of our presenters come on and present. And we do encourage all of you all to join us in the Discord and let's continue the conversation. There's a lot more information for us to learn and gather, and a lot more discussions to have. I'm sure those of you who stayed tuned and watched and, were able to jot some things down and probably have a wealth of questions. I know I did, right? Especially about medicine and now about law, right? And I think, there's more to dive into for those two really important industries right now.
Yeah, I love the fact that she's talking to legislators, which we sorely need. They definitely need the education.
Mm-hmm.
Yinka, what time can people join us on the Discord for the AMA today?
Yes, it's going to be at 1:05. We're going to also do a hybrid with Twitter Spaces. So under BW Blockchain, you will find that the Twitter reminder has already gone out. I will have the Discord up if it's not already up, and then we'll be on Clubhouse under Black Women in Blockchain as well. So we will be on 3 different spaces that you guys can find us. But you don't have to join all 3, just join one, but there's options out there. We're truly trying to make this decentralized. Really want to continue that discussion because I think it's very important.
And you guys make sure you tune in tomorrow for Futuristic Fridays, where we explore the metaverse with Nicole. That's going to be awesome.
Yeah, when we first started this, I don't even think we even had the vision of the end coming, right? Well, unfortunately, tomorrow, is our last Futuristic Friday. So I really want you guys to tap into this one. And it's going to go down with a bang, right? I mean, all of it has been fantastic so far. So I know Nicole has something up her sleeve, so you don't want to miss tomorrow's last Futuristic Friday.
Okay, with that, you guys, we wish you adieu, and we hope that you can join us back here again in the Discord at 105. And thanks for letting us into your home, your car, wherever you're listening to this from. And we'll see you tomorrow and later in the Discord.
Bye, everyone. I was dancing. Were you dancing, Corey?
Yep. I think we're going to have to leave the studio to end this because neither one of our production people are here. Bye, you guys.
Nicole wants us to have bloopers so that people can be like, oh, I remember they thought they were still off.
We're not. Well, we got one here. See you guys in the Discord.
Bye, everyone. For real this time.